Good evening, everyone. Evening is a pause button that gives you a breather before you jump from one part of the day to another. Let's spend this evening together and make it be meaningful. Sameeksha presents Amaya National Seminar with paper and poster presentation. And I warmly welcome each and everyone in this moment. And before starting our presentation, I would like to invite our respected panel members. First, I invite our Agatanandra panel, Dr. Ashwadi S, Dr. Veena Nath, and Dr. Revati Raj. Next, I invite Swastavritta panel members, Dr. Sujitra, Dr. Reshmi R, and Dr. Sridevi. Next, I would like to invite Prasuti Tantra panel, Dr. Deepthi, Dr. Sri Lakshmi, and Dr. Krishna Priya. Next, I invite Kaumara Bhritya panel, Dr. Aradi Dinashekhar, Dr. Sulata Nandakumar, and Dr. Rajanish. And I invite the Kaya Chikitsa panel, Dr. Ramesh P, Dr. Bhagya Soman, and Dr. Kavita Raj. I invite Shalakya Tantra panel, Dr. Bilender Bopale, Dr. Vaishak Raj, and Dr. Arya K. Panikkar. Next, I invite our Dravya Guna panel, Dr. Vishwanand Patil, Dr. Sri Rekha, and Dr. Kalyani. Next, I invite our Shalyatantra panel, Dr. Arun Krishnan, Dr. Krishnananda CR, and Dr. Usha. And I invite Panchakarma panel, Dr. Jinsi Joseph, Dr. Mahesh, and Dr. Ashwini Somasundaram. Next, I invite our Samhita panel, Dr. Ramadevi S. and Dr. Kavita Sajish. And I invite our Rasam Vaishajya panel, Dr. Ramyaji and Dr. Sindhu Lakshmi. And finally, I invite our Rajna Sharida panel, Dr. Vivek, Dr. Sri Lakshmi, and Dr. Krishna Priya. Once again, I invite all the panel members and participants. First, we have a paper presentation on the topic Effect of Vidangadi Gugulu in Nadi Vrana by Dr. Asmita Ramesh Padvi. I invite Dr. Asmita Ramesh to present the topic.
Good evening, everyone. I'm Asmita Padvi from SMBT Ayurved College, Maharashtra. My guide is Shilpa Bade, and I am presenting a study on the effect of Vidangadi Gugud in Nadivran. Introduction. Pilonidal sinus is an infection under skin, and it is a cavity containing hairs that is found at the base of the spine. Hair containing sinus or abscess is the sacrococcygeal area. Pilonidal means nest of hair and is derived from the Latin words for hairs and nest. This disease was invented by Hodges in 1880. It is most common in teenagers and young adults. In Second World War, this condition was known as a jeep disease and was felt to be from sitting for a long period in jeep vehicles. According to Ayurveda, it can be considered as a nadivran, means a blind tract formed by unhealthy granulation tissue due to the pus formation. And this disease occurs at natal cleft and cause discomfort, embarrassment, and absence from work for thousands of young people annually. It is needful to study of pilonidal sinus according to their properties of Vidangadi Gugul. It is useful in pilonidal sinus. Case report is 30 years male patient visited our OPD of Shalyatantra department for Ayurvedic treatment of pilonidal sinus. He presented with complaints of pain in sacrococcygeal region, pus discharge on and off, itching over boil and discomfort over prolonged sitting, and constipation on and off. On local examination, we found on inspection of a sacrococcygeal region, the patient was hairy and had boil with small sinus opening uh, near sacrococcygeal region with pus discharge through the opening, foul smell, mild swelling, tenderness present, external opening to the gluteal natal cleft. Probing test was done through the external opening to assess branching and extension of a tract. The tract approximately 1.2 centimeter. On per rectal examination done due to assess any anal pathology. Investigation done. The investigation root, routine blood and urine examination were done and report was normal. Diagnosis, the final diagnosis made was nadivran, that is pilonidal sinus. Treatment, Vidangadi Gugud, material and methods, drug review, Vidangadi Gugud, form Vati, dose 500 mg tablet given for 30 days, twice a day after meal, follow up during treatment, first 8, 15, 20, 22 and 30 day, after treatment 37 day. Ingredients of medicine is Vidanga, Trifala, Trikatu, and Gugud. Assessment criteria is subjective criteria, that is pain, and objective criteria is discharge. Grading for assessment criteria. For subjective criteria, pain measured by visual analog scale, and for a subjective for objective criteria discharge. uh, Here result and observation. I was select a patient according to the selective criteria. Vidangadi Gugul was given to select patient and observe the patient during treatment and after treatment according to their follow up, and finally I got a test result on pain, itching, and discharge shown in the table. Discussion. There are there are so many modalities are available in the treatment of pilonidal sinus. Selection of inappropriate operation and inadequate post-operative care are the main cause of recurrence. Hair growing into the healing wound is probably, and for this reason, need for the study of Ayurvedic medicine, that is to find out the effect of Vidangadi Gugud in Nadivran. Vidangadi Gugud is one of the Gugud Kalpas explained in the Vrana Ropan Shodhan Vidhi chapter of a Yoga Ratnakar. It is unparalleled medicine which can be effectively used for a Vrana Ropan and a Vrana Shodhan. In this kalpa, Vidanga is the chief ingredient. In this composition is the best antihelmintic. It is used for effectively curing worm infection and infections. Thus, it serves the purpose of healing the infected sinuses. Likewise, Triphala and Gugul are also best antiseptic and antibiotics. The combination of these ingredients makes compound best wound healing agent, which also wards off the infections. Trikatu is an excellent digestive fire and sets right errors of metabolism. Food taken is effectively digested and it essence nourish and support body. Proper supply of nutrients will enhance healing there with no tissue depletion due to malnutrition. Vidangadi Gugud are highly effective in destroying the morbid kapha, arm, and kleda, thus aborting the suitable environment for development of infections. These actions of Vidangadi Gugud helps in proper healing of wounds, infection, and sinuses. Gugud, Triphala, Vidanga are all rasayana rejuvenation medicines, disease modifying medicines, and immune modulator. Thus, the medicine not only helps in healing the above said diseases but also in preventing their recurrence by boosting the immune responses of the body. Hence, all these properties of the drug and the action will have helped to cure the disease. Conclusion: Pilonidal sinus is a therapeutic challenge. This cause study highlighted that Vidangadi Gud is safe and effective in symptomatic management of nadi vrana. Here is the references. Thank you.
Doctor. Doctor. Hello.
Hello.
Um, Myself from the panel, Dr. Ashwati.
Yes.
Actually, you directly started with the Vyoshadi, means Vidangadi Gugulu, or before that you had started any medications?
Okay. Uh,
Hello.
can I start again? Hello.
No, no. Actually, you
Huh.
have given the medicine. No, directly when a patient come to you, you
Huh.
without any medication that kashayams or any aristas, you directly started with this Vidangadi Gugulu, or after
Huh.
some of the Pachana Devana and some Shodhana therapies, you had started this.
Uh, uh, after take the allopathic medicine, after that we start the vidangadi gugud.
No other hours Devana Pachana drugs or Shodhana you didn't done for that patient, no?
No.
Actually, how many patients you had done this study?
Single case study.
Single case study, okay. And the discharge and pain is reduced. How many days? 40 days. How many days?
30 days.
30 days. Okay. And the discharge is completely stopped, or you had got some relief with the discharge? How the interpretation was? The chart, your chart was so small, so I couldn't see that.
uh, uh, the relief was not 100%.
Okay.
uh,
Then after this medication, you had given any other medicines for the patient after
uh,
Vidangadi before 30 days, no? After that, you had given any other medicines?
no ma'am.
Okay. The patient is on follow-up now, or that how the next follow-up? How many days after you told him to come?
30 7 day I will every
That's it.
7. uh,
And how is maintain? You can maintain that condition of the wound as such, or it is increasing after the stoppage of Vidangadi Gugulu?
sorry, 30
Actually,
30 days after.
no, no. Actually, after the
uh,
stoppage of this Vidangadi Gugulu, no, the next follow-up
uh,
after 7 days.
37 days.
37. After
uh,
37 days.
uh,
Okay. How that he can maintain the same conditions, or the discharge is getting increasing?
No, ma'am. Discharge is a decrease. Pay and itching. There is a itching is a reduce.
Okay. Okay. Thank you, doctor. Thank you. The preparation you had made by or any that available for any market, this Vidangadi Gugulu?
In our pharmacy, ma'am.
Okay. Thank you.
Thank you, Dr. Ashwati. And thank you, Dr. Asmita. Next, I invite Dr. Sunanda Ram Matkar to present the topic Ardhita Chikitsa, a case study. I invite Dr. Sunanda. So next, I invite Dr. K. Durganaga Sirisha for the paper presentation on the topic Management of Staulia with emphasis on Rukshana Karma.
Hello, am I audible?
Yes, doctor, please start.
Good evening, everyone. I am Dr. K. Durga Nagasirisha from Dr. NRS Government Ayurvedic College, Vijayawada. I would like to present my topic on management of Staulia with emphasis on Rukshana Karma. So coming to the introduction, in the current era of modernization, drastic changes have taken place in dietary habits and mode of lifestyles, which results in participation of various metabolic diseases. Obesity is one among them, characterized by excessive accumulation of subcutaneous fat and other tissues as a result of disturbed metabolism. Obesity contributes too much morbidity in the population and a precipitating factor for various killer ailments like diabetes, hypertension, heart diseases, etc. Obesity has been described by the term Staulia in Ayurveda. If you see Nidana of Staulia is due to continuous intake of Guru Shita Madhura Ahara, lack of physical activity causes kapha vriddhi, which vitiates rasa producing medas. This medas gets obstructed in abdomen, causing obstruction to vata. As a result of obstructed vata moving inside abdomen, Agni gets stimulated and becomes more powerful, causing voracious hunger. Hence, Staulia is described as Santarpana Janya Roga, which results from Medo Datvagni Manya. So, Rukshana Karma. So, Rukshana is said one among the karmas by Acharyas. It is safe and effective modality used both as Bahiparamajana Chikitsa and Antaparamajana Chikitsa. Rukshana Paribhasha. Rukshana is told as Aprema and Achitvana according to Shabda Kalpa Druma. The quality which is devoid of strictness is Ruksha. Sneha Suine, which means devoid of Sneha or absence of Sneha. So coming to gunas of Rukshana Dravya, the Dravya having the qualities like Ruksha, Lagu, Kara, Ushna, Sthira and Apichila are Rukshana in nature. Karmukata of Rukshana Dravyas. Rukshana Dravyas have qualities such as Lagu, Ushna, Sthira, Ruksha, Katina, etc. So Rukshaniya Rasa. Among Shadrasas, Kashaya, Katu and Tikta Rasa act as Rukshana. Kashaya Rasa is said as the best Rukshana, Tikta is the least Rukshana, and Katu Rasa is said as the moderate Rukshana. Ahara and Vihara having Rukshaniya properties. Coming to Ahara, Sarshapa, Pinyaka, Yava, Takra, Madhu, etc. were the Rukshaniya Ahara. And coming to the Vihara, Madhya Nitya Sevana, Vyayama, Vyavaya, Chinta, Shoka were the Rukshaniya Vihara. And other dravyas like Triphala, Shunti, Maricha, Pipali Mula, Chitraka, Jiraka, Shatapushpa, Kutaja, Shigduru, Shonaka, Bilva, Ela, Kiratatikta, Chandana, Katuka, Videnga, etc. were said as Rukshani dravyas. Uddhalakana is said as the Agra Ruksha Dravya by Charaka. Mode of administration of Rukshana. Rukshana can be administered into the body into two forms. One is Abhyantara and the other is Bahya. Abhyantara Prayoga. Ushnajala Pana, Kashaya Pana, like Amrutottara Kashaya, Nimbadi Kashaya, and Aristas like Abhya Arista, Takra Arista, and Churna Kalpanas like Sudarshana Churna, Vaishwanara Churna, Ajamodadi Churna, Shaddaran Churna, Tripla Churna, etc. And Rukshana the Evagu also. And coming to Deepana and Pachana forms the most effective steps in handling the morbid Vata and Ama. Example, Panchakola Churna. It improves digestion by relieving digestive complaints. It is also used in initial phase of Panchakarma treatment. Effect of Tridoshas. It balances Vata and Kapha. So if we see Bahya Rukshana, external therapies like Churna Sveda, Atapa Sveda, Udvartana, Lepas, etc. Udvartana as Rukshana. Reinforced rubbing of body with Churna. It pacifies Kapadosha and causes liquefaction of Medas, produce stability, compactness, and strength to the body parts. It is a type of Rukshana Kriya which is more specific in Twak and Medodhatu. Example, Kola Kulutadi Churna. Swedana can be done in two ways, Ruksha Sweda and Snigdha Sweda. Sagni Sweda can be taken as Ruksha Chikitsa. In conditions where pain and associated symptoms are due to Ama or Kapha, we generally prefer doing Ruksha Sweda or dry fermentation. Example, Churna Sweda with Ushna and Rukshna Dravyas. Rukshna Basti. Rukshna Basti mainly aims to bring Sneha Bhava, thereby useful in many Santarpana Janya Vikaras. Example, Lekana Basti, Trifalakvada. The ingredients will be Trifalakvada, Gomutra, Madhu, Kshara, Ushakadi Ganadravyas as Prakshepada. It's a wonderful combination for the purpose of Rukshana. And Ruksha Virechana. Ruksha Virechana is done using Ruksha Guna Pradhana Dravyas. According to Sushruta, the person having Snigdha Sharira, one whose body has doshas were treated with Ruksha Virechana. Example, Tripla Kashaya. Rukshanasya. Kashyapa classified Rukshanasya into two types, Sodanasya and Purananasya. Shodhananasya involves dravyas which are having Karshana properties. This acts as Sodhana and brings Rukshana in the Udvajatragata areas and thereby specifying Kapha related disorders. Example, Anutaila. Rukshana in daily practice. Vyayama, Udvartana, Tambula Sevana, Dhumapana, etc. were performed in daily routine is also a part of Rukshana only. Rukshana is ideal in Dakshinayana, which is achieved by Ahara Vihara having Ruksha Guna. Rukshana are achieved by dravyas like Eva, Madhu, Madhya, Arista, Vyayama, Vyavaya, and Udvatana, etc. Application of Rukshana as a main line of treatment in Staulya. In Staulya Roga, there will be obstruction of passage of Vata by morbid Medodhatu. Thus, Vata moves abundantly in Kosta and cause Agni Dusti. Dusti of Medosrotas leading to Ativruddhi of Medodhatu along with Mamsa Dhatu. The person buttocks, abdomen, and breast become pendulous and he suffers from the deficient metabolism and energy. Rukshana Dravyas, due to their Rukshadi Gunas, help to liquefy and clear the stagnant morbid factors, thus clearing the obstruction in Medosrotas. Rukshana also helps to relieve stiffness and other symptoms caused due to excessive fat accumulation. Importance of Rukshana in Sodhana. According to Ashtanga Hridayara, in case of obese persons having large amount of kapha vitiation and irregular digestive fire, initially Rukshana karma has to be performed followed by Snehana. Such persons will not suffer from diseases caused by excess Snehana. Sneha administered in such a way doesn't get accumulated in the body and helps in letting out the doshas smoothly. Many of the times during procedures such as Snehapana, we often come across Vyapats, means complications. It may be due to not following procedures or improper administration. In such conditions, Rukshana can be used effectively, especially in Sneha Vyapat. Conclusion. Rukshana, as one among the Shad Upakramas, mainly brings Sneha Abhava. Ruksha Dravyas, due to their Ruksha Ushnadi Gunas, helps in liquefying and clearing the stagnant morbid doshas, thus clearing the obstruction in srotas. Sthaulya being a metabolic disorder where continuous lifestyle and dietary habits should be observed and can be managed effectively with Rukshana Chikitsa in Ayurveda. Thank you.
Thank you, doctor. Next, I invite Dr. Rujita Maruti for paper and poster presentation. Dr. Ruja Maruti.
Hello, ma'am.
I invite.
Yes.
Hello, doctor.
Hello. I am audible?
Yes, doctor.
Yeah. Good evening, all. I am Dr. Rucha Maruti Vendodekar. I am a second year student of MD Kaya Chikitsa from PMT Ayurved College, Yoga. And my guide name is Vaidya Sandeep Suse. Today I am speaking here about Chikitsa Chatushpada. So Chikitsa Chatushpad is a very important topic. Like aim of Ayurveda is to maintain the health of healthy person and to eradicate the disease of the diseased persons. So to eradicate the disease, Chikitsa of imbalanced doshas is very necessary. In Ayurveda, the success of Chikitsa depends totally upon 4 factors, which are known as Chikitsa Chatushpad. So this Chatushpad includes Bishak, Upastha, Rogi, and Dravya. If this Chatushpad endo with their proper qualities, then they are responsive kind of diseases. But these factors can succeed in the cure of diseases only when they are actively engaged in the fulfillment of the objects. So here the references in Samhitas are given like in Charak Samhita Sutrasthan 9th chapter, Kuddak Chatushpadya, and in Sushut Sutrasthan 34th chapter, and Ashtang Hridaya Sutrasthan 1st chapter. So we are going to take Bishak Guna according to Charakacharya. He says Shruti Paryadvada Tattvam, Bahusha Drushtakarmada, Daksham, and Shaucham. So Shruti Paryadvada is having detailed knowledge about the Shastra and entire science of the Ayurveda, and having extensive practical experience is a Bahusha Drushtakarmata. And alertness must be there. So purity of body and mind is denoted with the Shaucha. And according to Vagbhatacharya, he says all these qualities, but he denote the term Tirthartha Shastrartha in the place of Shruti Parivada Tattvam, according to Charakacharya. And according to Sushrutacharya, he says Tattvadikata Shastrartho means the same only, having a detailed knowledge about the Ayurveda Shastra, its concepts. And Drushta Karma is again extensive practical experience of Chetanadi Shastra Karma and all. Like he is a surgeon, Sushruti is surgeon, so he says all about that. And Swayankruti means having a capability to take his own decision. Laguhasa is not tremble or fear to do the Chedanadi Kriyas. And Shuchi means again purity in body and mind. Shura, not having fear and greed. Sarjopaskara Bheshaja means he should be well equipped with all types of yantras and shastra and medicines. Pratyutpanna Matyardhiman means well oriented and having wisdom of wrong and right things. Vyavasai is enthusiastic to work in all worst conditions also, and that is the professionalism, we can say. Visharada is a wise man, he should be a wise man, and Satya Dharma Paro means he should be a truthful person. Then again, Bhishaja Guna, second Chatushpad of this. According to Charak, he says Bahuta, Yogyatvam, Anekavidha Kalpana, and Sampat. So Bahuta is abundantly, it should be available, firstly, and it should be effective. Then again, it can be used with various pharmaceutical forms, multiple use should be there. And Sampat means a richness in efficacy or a potency. And according to Vagbhatacharya again, he says all this, but he says term bahuguna means with multiple qualities. The one drug, that is, we can take an example of guduchi. Then according to Sushrut Acharya, he says prashasta desha sambhutam means it can be cultivated in a good land. Prashasta hani chaudrutam means collected on a right time. Yukta matram in the right quantity. Manaskantam is pleasant to mind. Gandhavarna Rasanvitam is having its own natural, normal order, color, and taste. Doshanam means capacity to stabilize vitiated doshas and prevent further prognosis. Klanikarakam is not causing any drowsiness or things, means no side effect should be there. Vikari, avikari viparya means not creating side effects. Sameeksha Dattam Kalecha is it should be administered with the proper right thinking. Then again, third Chatushpad is there, like Paricharaka, or it can be said Upasha. So according to Charakacharya, his four qualities are denoted like Upacharajnata, means intelligent enough to understand the physician's instruction, obviously, and act accordingly. So Daksha, second quality is there. It says alert, he should be alert or active. Like he should listen carefully and he should be alert. Manuragasha is affection and attachment towards the patient, because he is again with patients always. So he should be Anuragash. Shaucham, he should also having a purity in mind and body. Again, Vagbhatacharya says all these qualities with he term donated like Buddhimana. He should be Buddhiman to intellect enough to understand the physician's instructions. According to Sushrutacharya, he says he should be a snigdho, means affectionate, pleasant, and cool in nature. Jugusu means who does not speak ill of anybody. Like he should encourage patient, he should inspire patient to recover easily. Balvana is strong to handle any situation. Yukto, Vyadhita Rakshane, well attentive to requirements of sick patient. And Vaidya Vakyakrut means who rightly follows the instructions of physician. And Shanta means do not exhaust easily. He should capable of enough to get all work done. Again, fourth and final is Chatushpad is Rogi. According to Charakacharya, his gunas are like follows. Smruti, he should have a good memory to denote all his history and all. Nirdeshakaritva is obedient to his physician. He should not like, I will do my on my risk. He should obey the physician's instructions also. Abhirutva is fearless or courageous, having good strength to tolerate. Here again, we can say the Satvika patient means who having a Sattva and having a very critical disease also. He may require with uh, he may recover with his own Sattva. So it is important like abhirutva quality. And Nyapakatva means patient should able to describe symptom about time in order. Means he should denote like before 2 months I have these symptoms and all. So he should enough Nyapakatva. According to Vagbhatacharya, he terms denoted like Adhya. Adhya means reach enough to expenses, because if the critical care patient is there, then he should have that much uh, richness, so he can all expenses can be get it. And Abhirutva means again that Sattvavanapi means he term denoted Sattvavanapi for the Abhirutva. The meaning is same. According to Sushrutacharya, he said Aishman means having long life. He should have a long life. Like Asadhya or the diseases are like they can be get into a death. So he should be having a long life. Sattva again fearless, strong, and tolerance for all the treatment done. Sadhya means easily manageable. Dravyavan, he should having a rich enough to do all the expenses. Adhya like. Atmavanapi, again Sattva, having a control on body and mind. He should proper following the instruction, Patya, Apatya, on all that. Astika, having faith in Deva, Loka, Punarjanma. So he should having a Astik Tattva means he should have a faith in a doctor, all the treatments, and Deva again. Vaidya Vakyasto is he should obedient to his physician. Thank you. And my poster presentation. My poster presentation is on Shita Pitta, Udarda and Kotha. So in Madhav Nidan, it is mentioned Shita Pitta Maruta Sansparashat, Tadushtav Kapa Maruto, Pittena Saha Sambhuya, Bahiyanta Visvapataha. So again, the causes are mentioned in Samhita like Madhav Nidan. Shita, like Shita objects are mentioned in this thing, like ice cream. And today's in modern world, we can correlate it with the ice cream and all, cold drinks, frozen items, or air condition Shita Maruta, we can say. So it the air of fan or AC. Again, the Pradushtav Kapha Maruta means all these things like polluted fumes or milkshakes are also can be one of the cause. So these all are causes to turn into vitiation of Vata and Kapha dosha. So along with this, Pitta is also vitiating, and with that, especially the Bharajak Pitta, we can say, because it is presented in the form of skin infection like. So this is all doshas are vitiating skin from outside like twacha, and inside it is vitiating the raktadi dhatus from inside. So for this, if the kapha dominant vata pitta dushti is there, then it is called as udarda. So the shloka is so utsanga saragaishcha kandum udbishta mandalehi. So this is like all these pictures are denoting like that only. So it is differentiating the udarda. If kandu symptom is dominating, then it is kapha dominant nature. So we can denote it as a udarda. And if it is vata dominant thing, vata dominant kapha pitta dushti is there, then it is a shita pitta. So it is denoted specifically with the variety donsha samsthana. The wasp, we can say the variety is wasp, and his bite is like looking like this. So this is a shotha because of variety damsha samsthana. With again pitta dominancy is there. It is sakandu toda bahu jwara, all the symptoms, vomiting and all the symptoms are denoting here. And again the next thing is kotha, we can say. So all these above mentioned causes are there also, but one specific cause is vamanadi vyapad. Means if the panchakarma is given to the patient, and if there is a avega or like that, vyapad is happened, then the vitiation of pitta and kapha is predominant. So in that case, asamyak vamanodiranar pittam sleshma anigrahi. So mandalani sakandula, if the chronically this happened, and again because of the woman vapor, the pitta kapha denotes, and this is the typical picture of the kotha, we can say. And all of this having a purva rupas like pipasa, thirstiness is there, aruchi, and not having a proper appetite or taste to the mouth, and sadeha sadanga gauravam, raktalochanata, we can say. And these are the purva rupas of all of this. In again pathya is denoted, that is we can say dadima, we can eat tulasi, haldi, and kokum. In kokum is a very important thing because it is amla guna but not provocating pitta. So this is very important. And shigru is also one of the thing which can be given patient for the pathya. Then in chikitsa, we can say all the kalpas we can use. For the doshika chikitsa, Arogyavardhini, Gandhak, Rasayan, Mallasindur are again the kalpas which are kaphavata reducing, and Srotoshodak and Dipan. So, and Lagusutshekar, Shita Prabhanjana Rasa, Sutashekar, Suvarna Basma, Praval Basma, Haritrakhanda, all these are for the Samprapti Vigatana. So because of this, we can break the Samprapti, and Shodhan we can also do. And all of these are the main combinations we can use in the Shita Pitta. Thank you.
Doctor. Hello.
Hello.
In you don't know, in Shepita there is when physical urticaria there is predominant of Vata.
Yes.
That is there will be the role of Rajaka Pitta. That's only the Rajaka Pitta is getting affected there. Because
Yes.
he's telling no. In the context of that, there is the Jwara is telling, the Kilojana is telling, Shakti
Yes.
is. So not merely the Rajaka Pitta. Actually, the pitta that is getting vitiated, no?
Yes.
From the Pajaka pitta or 1 minute.
Hello.
1 minute. Okay. The older note in we can't say that, no? Pajaka pitta is only is affected over there.
Yes, ma'am. But means I have told this because it is presented on the skin. So specifically, I'm saying dominating the Pajaka Pitta is there.
No, actually the Bhajana Pitta's properties which does the bhajana of the body,
Yes.
which gives the glow. No.
Yes, ma'am.
Actually, it's only for that. Actually, I'm telling not only the Bhajana Pitta,
Yeah.
Actually, the whole pitta is involving there.
Involved in, yes. Yes,
Okay.
ma'am.
Actually, it is because of the Rasadushti. Rasadushti, actually, the Rasa Sara Purusha, actually, that is the Saptapsara Purusha.
Yes,
So,
ma'am.
the whatever the things which is affected for the Rasadhatu or Rasat Srodo Dushti,
Yes.
which is manifested in the Tokdhatu.
Yes.
Okay.
Yes, ma'am.
So, that's why we are getting all the lectures like Chhatri, Avibhagam, Lojana, and Daha, Paga, everything.
Yes, ma'am.
And so we have to, the treatment should be based on for the Rasa Srodo Dushti. Okay.
Yes, yeah.
Thank you. Nice presentation.
Thank you.
Thank you, Dr. Ashwati. And thank you, Dr. Vija. Next, I invite Dr. Arati Raj for presenting the topic critical analysis of Adhisveda with respect to Staulya.
Hello, am I audible?
Audible, doctor. Clear.
Yes, doctor.
The screen is also visible, no?
Yes, doctor, visible.
Okay.
Yes.
Good evening, everyone. Myself, Dr. Arati Raj, PG scholar, Department of PG Studies in Ayurveda, Samhita and Siddhanta from Sri Sri College of Ayurveda. I am presenting on the topic critical analysis of Adhisveda with respect to Staulya. These are the contents of my presentation, which include introduction, review of literature, discussion, conclusion, and references. Moving on to the introduction, Sweta is mentioned in Brihadrayis as one of the Lakshanas of Staulya. And by Acharya Charaka, this is explained as one of the Ashta Lakshanas of Staulya. And Sweta can vary on various conditions like seasonal variations, locations, and it is high in a Stula person, and it can increase on Vyayama and on Aharas like Katu, Ushna Aharas, and on Manasika Karanas like stress, etc. can increase the sweating. Then Adhisveda in Staulya results in some of the difficulties which a Staulya person is experiencing. That is increased wetness of the body, glani, increased thirst, Shida Kamida, Kantu, Daurgandhya. All these are experienced by a Staulya person. And also in Ashtangridaya, it is explained as Sweda Vritti, Svedo, Adhisvedo, Daurgandhya, Kanduhu. And next, the analysis of Adhisveda will help in the help to ease the people in his or her daily activities. Then the review of literature, Nirukti of Sweta, this is Svityade Anena Idhi Sweta, that which causes sweating is Sweta, and Sweta Kleta Saukumarya Krit, that Sweta which can make the skin moist and soft. Malaha Swetastu Medasaha, that is, it is a mala of Svetas, mala of Medas, and it is formed on a Kitta Amsha on Ahara Pachana. And the site of Sweta is explained as by Ashtangridaya Sutrasthana, Nabhiramashaya Svedo, Lasika Rudiram Rasaha, Driksparshanam cha Pittasya Nabhiratra Visheshada. There are many seeds explained for Pitta, in that Sweta is one of them. And Asraya Bhava of Sweta and Pitta is explained Ashtangridaya as Pittam tu Sweta Rektayoho. Next, how the elimination of Sweta from the body is done is explained with the sloka of Sutruda Nitanasana, Krishna Deha Charovyano, Rasa Sambhahano Udyadaha, Sweta Asriksravanaschavi, Panchada Cheshtetyabi. Here the importance of Vyana Vayu is explained. And Vyana Vayu helps in the easy excretion of sweat from the body. And all other functions like conduction of sweat from roots of hair and opening of the skin pores, all this is done by Vata. And Sweta Bada is explained by the Charaka Samhita as Sweta Bhada iti Svetasya Anivrittihi, as causing the discomfort to a stula is Sweta Bhada. And this can be interpreted as Anivritti, as A, Ni, and Vritti. That the word Anivritti is interpreted as increased flow of Sweta in this context. And in Charaka Sutrasthana, it is explained as Medasaha Sleshma Samsargad Vishyanditvad Bahutvad Vyayama Sahatva cha Sweta Bhadaha. This is sloka which explains how the Sweta is formed in a Staulya, in a Stula person. So Medas with Shleshma, which can undergo Vishyantana, and the Guru Guna and Bahuguna of the Dushyas, and the Rogi being Abala become Vyayama Sahatva, causing Sweta Bhata. And Malavriddhi Gurdaya Laghavan Mala Samshayam, Malayanana Buddhyeda, Sankot Sargata Tivacha. Here the sloka means that the excessive excretion of a mala it causes the Malavriddhi. So here we can interpret as the Medo Dhadu Mala Sweta, which is interpreted as the Malavriddhi here in this context. And the discussion comes as Vishyantana. Vishyantana meaning the Syantana, Drava Dravya Ksharana Prasrava. Ksharana is meaning as Mojana, that is the moving out of the body. So in Adhisveda, Dushyas which get lodged flows out due to the Saraguna. So the increased Agni in the Koshta helps in the liquefaction of the Dushyas, causing the Vishyantana of the Dushyas. In Staulya, due to the Nidhana, Sama Anna Rasa flows within the body. And Gurutva, Tatra Brahmane Shakti is our Guru is explained. So the Kaba and Medas is already heavy in its nature, which increases in a soul as quantitatively and quantitatively. This heaviness makes him uncomfortable in doing all his daily activities, which increases thereby as the Glani. In Stula, the Sama and Rasa produce a Medas, which is Adhisnigdha, and this makes the Stula again Guru. And Bahutva means due to the excess Medas and Kaba, there can be excess Kleda in the form of Kaba and excess Sneha in the form of Medas. All this will be expelled in the form of Sweta. In Staulya, the excess Sama and Rasa causing Medova Srodo Dushti, leading to Srodo Roda, causing the Malavritti. And this Vyayama Sahatva means it is not directly connected with the Atisvedana, but we have to understand or interpret as even the less minimal activity, physical activity is sufficient for producing sweat in a person. So in Staulya, the Sodoroda causing the Dhatwagni Mantya leading to Balakshaya, hence making him Vyayama Sahatva. So all the above factors which I have explained as Vishyandana, Bahutva, Gurutva and Vyayama Sahatva, all this contribute equally in the formation of Sveta in a Stula. So this is a slight comparison of the Sveta and the comparison of Samprapti of Sveta with the Staulya. So Kaba Vriddhikara Ahara Vihara causing Avarana of Vayu with the Metas and Kaba in Kaushta. All this increases Agni. And increased Agni can increase the food intake, leading to Staulya. And the increased Agni melts and flow, increases the melting and flow of the Dushyas, which attain Bahutva, Gurutva, and Vyayama Sahatva, leading to Sveta Bhada. Next, moving on to my conclusion, Sweta is produced as a Medodhadumala, which moistens and softens the skin. Sweta is one amongst the seat of Pitta, out of which Nabi is the Visheshasthana, as explained before. And Vada plays a major role in the production of, in the conduction of sweat, where the excretion of sweat is mainly done by the Vyana Vayu. And Sweta Bhada can be understood as excessive discomfort experienced by the Stula due to the oversweating. No other person is not that affected with the oversweating. Only the Staulya, in Staula, it is more prominent. The Medas and Kaba with the influence of excess Agni, which can undergo Vishyantana. And the Dushyas are Guru in nature, which attain more Gurutva in Stula, both quantitatively and quantitatively. With respect to the Pagakala of Medodhadu, the excess Kleda gets eliminated as Sveta. In Stula, due to the Vyayama Sahatva, even the minimal exertion can produce the Atisveta. And these are the references which I have explained. And with this, let me conclude. Thank you.
Thank you, Dr. Arati.
Okay.
Next, I invite Dr. Tejaswini Milind for presenting the paper on the topic Effect of Tribala Kruta Ashodhana in Allergic Conjunctivitis, an Ayurvedic approach. I invite Dr. Tejaswini.
Dr. Tejaswini, your screen is visible. Please start the session.
Hello, Dr. Tejaswini. Am I audible?
Dr. Tejasini, we can't hear your voice. Dr. Tejasini, please reconnect your headset and unmute the voice. Dr. Tejasini, can you hear me?
So next I invite Dr. Aishwarya Meher for presenting the topic to study Bija Adhishtana as Garbha Sambhava Samagri with respect to infertility. I invite Dr. Aishwarya Meher. Dr. Aishwarya,
Yeah, ma'am.
can you hear me?
Yeah, hello.
Okay. Dr. Aishwarya?
Yeah, ma'am. Is it connected? Google Drive chalega kya?
No. It's
Can
not
you just
visible
give
to
me
your
some?
screen now.
Yeah, yeah. Can you just give me some a couple of minutes? I'll just share my screen.
Okay, so you can present next.
Yeah, yeah, sure.
Is it okay?
Yeah, yeah, no
Okay.
problem.
So next I invite Dr. Shraddha Patil for presenting the paper on the topic Review of Rasa Sindhura with respect to Pranavaha Srodhas. I invite Dr. Shraddha Patil for the presentation.
Yes. Am I audible?
Yes, Dr. Audible.
Oh. I have shared my screen also. Is it visible?
Visible, Doctor, visible.
Okay. Good evening, everyone. Today my topic is review of Rasa Sindhur with special respect to Pranavaha Srotas. Actually, in Rasa Shastra, there are many formulations which have been discovered, which has quicker action in smaller doses. One such is Rasa Sindhur, which is a Kupipakva Rasayan. It is prepared by a mixture of mercury and sulfur when it is processed in furnace for prescribed period, for prescribed time duration. Since it is a Risakalpa, its dosage value is also very less, ranging from 125 mg to 250 mg. It is used in Madhumeha, Rajakshma, Pandu, Saulya, Pranavaha Srotas. It has bronchodilating and antispasmodic effect, which is helpful in obstructive pathology of Pranavaha Srotadushti. Pranavaha system, it deals with inhaled flow of air. Chakrapani indicates respiratory system. It should be considered as Pranavaha Srotas. He also states that Prana indicates one of the 5 types of Vata dosha. He Pranavaha Srotodushti is mainly result of Vat Prakop or obstruction or change in the normal gati of Vata inside the body, especially of Prana, Udana, Vyana. The diseases of the pulmonary system includes pulmonary hypertension, embolism, COPD, etc. Introduction. Kupipakva Rasayan, it was first introduced in Rasendra Chintamani. Rasa Sindur is a Kupipakva Rasayan, which is prepared by using mercury and sulfur. Respiratory disorders, which are considered under Pranavaha Srota Vikara, they are the leading causes of morbidity and mortality worldwide. Most common respiratory disorders are asthma, bronchitis, COPD, which can be correlated to tamakshwas and kapachkas. Materials and methods. Now, in kapachkas, the lakshanas are prabhut ghanatva, snigdhatva, bahala kapha, which very well correspond to acute bronchitis or chronic bronchitis. But according to WHO, the terms like chronic bronchitis or emphysema they are not longer in use. They are combinedly they are termed as disease known as chronic obstructive pulmonary disease, that is COPD. Bronchial asthma is a chronic inflammatory disorder which causes recurrent episode of breathlessness. Tamakshwas is defined as difficulty in breathing, which occurs especially during night and cloudy days. It can be correlated to bronchial asthma. The pathogenesis is explained. Shwas, the pathogenesis include etiological factors, Ketu. Then visheshan of Vat and Kapha, Kapha Uddirana, Srotorod due to Kapha, Avaran of Vat, that is respiratory air block, Pratiloma Gati of Vat, entry into the Kapha Sthana, Samuddirana of Kapha, and which leads to Shwas. The Samprapti of Kas includes Vayu impeded from below, that is Adha Pratihoto Vayu, moves to the upper channels, attains the character of Udan Vata and sticks in throat and chest. Further, it advances to all the orifices of head, filling them. That is Avishya Shirasah Khani Sarvani Pratipurayan. It produces the breaking and jerking pain in whole body. It particularly causes strain and stiffness in Hanu, Manya, Akshi, Prishta, Uraparshva, and thus cough arises. Now, the pathogenesis of bronchial asthma, it is associated with chronic inflammation of the mucosa of the lower airways, causing difficulty in respiration. In COPD, there is a presence of airway inflammation and excessive bronchial secretions, which leads to cough reflex. Now, in treatment point, it includes that there is no unified treatment, as the pathology includes multiple varying factors. The drug which must be used in Kapachkas, it must possess Kartu, Ushna, Tikshna, Sukshma, Chedan, Kapanisharak, and Kasagna properties. And in Tamakshwas, the vitiated Vata and Kapha dosha is forcibly taken out from Pittasthana. This drug should also have Deepan, Pachan, and Srotoshodhan properties. Now there are kalpas which are described. Shwasakuthar, Tribhuvan Kirti, Lakshmi Vilas Ras, and Rasa Sindur. Rasa Sindur plays an important role in curing respiratory disorders as an independent drug and also as an adjuvant therapy. It must be given along with the Bibhita ki Kwat. The reference has been mentioned in Rasa Tarangani. It enhances the bulk of the fufusa and does kapasravan from Sukshma Srotas. In condition like Nasak Shobha, due to the recurrence of Shwas, it is proven beneficial. In Urashata, which is associated with Durgandha Kapha, it shows the best result when it is given along with Vasa Avleha or Branaropan Dravyas. In chest infection, it is given with Praval Basma, Rajat Basma, Maricha Churna, and honey. Rasa Sindhu, when it is given with Abhrag Basma, it is beneficial where Srotorod is noticed. Now here we come for the method of preparation of Rasa Sindoor. The Purva Karma, it includes collection of the necessary instruments, which is given in the slide, like Kupi Vastra, Multan Vritika, Valuka Yantra, Valuka Shilaka, copper coin, etc. Now the Shodhan of Parat and Gandak. Kajjali preparation. The Kajjali must be Shlakshna, Kajjalabhasa and Nishchandratva. Preparation of Kupi and selection of the bottle, wrapping glass bottle with mud smeared cloth. 7 layers are applied. Filling of the kajjali to kupi, fill 1/3 space for melting of the kajjali, also for sublimation of compound deposited in the neck of the kupi. Now placing of the kupi in Valaka Yantra. The Pradhan Karma includes first 3 hours we should give Mandagni and next 3 hours Madhyam Agni. Shalaka Chalan, Tapta Shalaka Chalan to burn the extra gandhak deposited in the neck of the kupi, and sheet to know the state of the kajjali. Observation of the fumes and flame. Color of the fumes helps to decide the substance. Caulking of kupi mouth. The caulking should be done in the absence of the fumes and flames. And performing copper point test, Shita Shalaka test, and appearance of redness at the bottom of the kupi. Paschat Karma, remove the scrape and remove the layers of the kupi. A thread stroke in spirit should be tied around the neck of the kupi and ignited. Keep horizontally the kupi and rotate the kupi to burn the thread. Then wrap the wet cloth. Mode of action. The mode of action includes Pranmaha Srota Vikar. It mainly involves 3 dosha, especially Kapha and Vata. Now, Rasa Sindoor has the capability to regulate 3 dosha, so it can be considered ideal for respiratory disorders. Its properties include Katu, Tiktaras, Ruksha, and Laghu Gunatmak, Ushna Viryatmak, and Katu Vipaki. And thus, it is effective in Kapha Pradhan Rogas. It also regulates Vata and Pitta. It is useful in Niyaman of Panchavat, mainly Pran and Apan. It does Pitta Nissaran without causing Rechana. In few conditions, Rasa Sindoor is contraindicated, such as Pitta Pradhan Shwasa, Shushka Kasa, and in Pitta Prakruti people, due to its Ushna, Tikshna, and Ruksha Guna. Finally, we come to the discussion and conclusion. Now, during preparation of Rasa Sindoor, mercury and sulfur undergo Shodhan and Murchana, which facilitates the attainment of the nanoparticles. And due to and in a study that mercury is present as 81% and sulfur 14%. It also contains minor elements such as calcium, iron, magnesium, chromium, aluminum, lead, and boron. And these elements also helps in improving the curative properties of the drug. The Rasa Sindoor acts as the rasayan and regulates the Rasa Dhatu, which is involved in respiratory disorders. As it has Yogahi property, it enters the Pranamaha Srotas. Rasa Sindoor is mixed along with other formulations which acts on respiratory system to enhance their properties. The Rasa Panchak does the Samprapti Vighatana. It has the property to pass through ADME, that is absorption, digestion, metabolism, and elimination easily. So Rasa Sindoor can be used in respiratory disorders effectively. Thank you.
Thank you, Doctor. Next, I invite Dr. Aishwarya Mihal for the presentation.
Dr. Aishwarya Mehar, please start the session.
Hello.
Dr. Aishwarya. Yes, Doctor, please start.
Good evening, everyone. So today I'm going to present the topic. Observational study it is to study Bija Adhistan as Garbhasambhav Samagri with respect to infertility. Next slide, please, sir. So let's go to the introduction topic. Introduction includes Definition of Sharir. Sharir is defined as according to Ayurveda, that is Sharir Nam Sakala Sharir, Badhyabhyantar Vastu Vivaran Parayan, Pradhana Purvangam Yadidam Achakshite Dwarbhutam Chikitsa Vidhan. That means the anatomical and physical study of whole human body, including external and internal organs. That is defined as Sharir. And the next shloka is the main shloka which describes the Garbhasambhav Samagri, that is Dhruvam Chaturna Sanidhya. Hello.
Yes, doctor, please continue.
Yeah. Dhruvam Chaturnam Sanidhyat Garbhasyat Vidhipurvaka Rutukshetram Bhavichanam Samagret Ankuru Yatha. This shlok describes the Garbhasambhav Samagri which Sushrutacharya has described. The four main points that are Rutu, Kshetra, Ambu, and Bij. So in ancient Ayurveda, Garbhasambhav Samagri is described as essential factor for conception. Sushruta has also mentioned germination of seed with achievement of conception, saying that if these four factors are achieved, that is Rutu. Rutu means it is correlated to season, or we can say period near ovulation. And Bij, that is correlated to seed. It means according to Ayurveda, it can be correlated to ovum and sperm. Ambu, that is water, which we can say is nourishing substance, rasadhatu. And Kshetra, it can be correlated to field, that is uterus of female reproductive system. If these four factors assemble together, then the conception will definitely occur, and that will be the healthy conception and healthy child. So the following shlokas also describe the Tadvarshi, the Dwadashan Kale Vartaman Surkupuna Jarapakva Shariranam Yati Panchakshatak Shayam, and Rutustu Dwadasharatram Bhavati Dushtartava. This is shlok for Rutu. Next slide, please. So Ritu means Ritu for two purposes, that is Garbhadhan, we can say fertilization, and Bijotsarga means release of ovum. So if these two things occurs, then the best period of conception without any morbidity, it will give best conception. And Kshetra is uterus, that is this is pre-secretory endometrial wall. Prepared fills results into good yields leading to viable pregnancy. That means you should also have uterus with healthy endometrial lining without any anomalies or uh, any disease. And the next third point is Ambu. Rasadhatu formed by digested food, blood, and intercellular fluid of endometrial tissue with healthy and required nutrient without any abnormality is quite helpful for the formation and development of fetus. Then last is Bij. Ovum of female and sperm of male in healthy state for quality child. Of all these factors are necessary in reproductive activity leading to pregnancy. So out of all these four factors, Ayurveda gives more importance to the Bij, which is not seen in the modern concept, where most of the time it is the etiology is not explained. So, what is the definition of healthy Shukra? That is Patikabam, Dravam, Snittam, Maduram, Madhuru Gandhishcha, Shukramikchanti, Kechittu, Taila Shaudram, Nibantaka. This is the definition of healthy Shukra, which means this Shukra should be Spatik, that is white in color, Drava, Snigdha, Madhur, and Madhuru Gandhayukta. Then the Artha, Shuddha Artha Lakshan is described as Sashasrup Pratimam Yattu Yadva Lakshar Sopamam Tadartavam Prashansanti Yadva Sona Viranjali. If there is any deformity in these factors, it may lead to infertility. This proposed work is undertaken to explore infertility in relation to Garbhasambhav Samagri. Next slide. So what is the need for the study? That is, Ayurvedic medical science has clearly mentioned main factors of conceiving and begetting healthy child. This is not only allows us to know the factors needed to form Gabble, but also helps us to understand area which should be focused more on. In the above discussion, it can be concluded that Garbhasambhav Samagri like Ritu, Kshetra, Ambu, and Bij plays major role in the infertility. Also, Ayurveda has stated study of dhatu formation, which helps us to check the potency of ovum. When all the other factors are normal, and according to modern science, the cause is unknown. The cause according to Ayurveda goes to the potency of ovum, where ovum is at fault, or you can say beach, that is sperm or ovum, which is at fault. Due to late marriages and changing lifestyles, PCOS, that is polycystic ovarian syndrome, is common in females, which is not treated on or diagnosed properly, leads to infertility. Next slide. So, review of literature. To explore the factors regarding Ritu, Kshetra, Ambu, and Bij anatomically, which leads to infertility. Review of Ayurvedic literature work related to study. In this, will seek to collect, compile, and analyze the literature regarding Garbhasambhav Samagri in relation to infertility in Ayurveda. And review of modern literature work related to study. Modern point of view will go to the infertility point to collect and compile the same, analyze the literature regarding cause of infertility according to modern literature. Next. Review of previous research work done related to the study. That is Dr. Shalini Verma from Uttarakhand University had done the work named the scope of Ayurvedic medicine and therapy in management of infertility. And secondly, Dr. Archana from Jamnagar. She has presented Ayurvedic management of primary infertility due to PCOS associated with multiple uterine fibroids. Then third is Dr. Ashwini Karandikar from Tirak Ayurvedic College, Pune, presented PCOS with infertility and its Ayurveda management. Critical appraisal on PCOD or PCOS and its treatment Ayurveda and allopathy by Dr. Snehvibha Mishra, Dr. Priya Mishram, Dr. Kiran Talavare from Shri Ayurvedic College, Nagpur. These are the references I have taken. And the methodology goes like the study, this is observational type of study for which OPD and IPD patients from the hospital will be selected for the study. And the total duration will be for 18 months. And population taken will be regular patients coming to OPD, IPD. And sample size will be 50 patients. Sampling method is random sampling. Next. And the calculation of the sample goes like prevalence of the disease is 15%. Then sample size is n, and the formula is on the screen, that is n is equal to z square pq upon e square, where p is the prevalence rate, z stands for standard deviation, q is 1 minus the prevalence rate, and e is the error of significance, that is 0.1. In this manner, the sample size calculated is 50. Next. The inclusion criteria for the study is the patients with age group of 25 to 35 years females, patients with PCOD, patients with infertility, and the exclusion criteria is patients with menopause, patients on palliative treatment, and patients with tuberculosis. The assessment parameters used will be USG of abdopelvis, particularly follicular study will be done. Next. And the subjective criteria includes the symptoms like hirsutism, oily skin and acne problems, and weight gain. And accordingly, present or absent, the symptoms will be marked. Next. Objective criteria includes pain scale. The gradation of pain will be as per the visual analog scale. Then the second point goes depression or mood swings, which is more common. It will be graded according to Hamilton Depression Rating Scale for first and second follow. And the menstrual problems will be graded according to the Mansfield-Wodarg Jorgensen scale, where spotting very light, light, moderate, heavy, or very heavy according to that. And the statistical test used will be chi-square test, will be applicable for this data. Next. And this will be the Gantt chart of the total work done for the 18 months period. Next. In the conclusion, the study shall be compiled and followed by proper listing of references, and as the conclusion can be stated. Thank you.
Thank you, doctor. I invite Dr. Tejaswini, Dr. Tejaswini Milind for the paper presentation. Hello, Dr. Tejaswini.
Hello, am I audible, ma'am?
Yes,
Hello?
Dr. Audible.
Yes. Yes, sir. Good evening, everyone. My topic is effect of triple agrit ashwatan on allergic conjunctivitis. I'm from SST Ayurved College, Maharashtra. My HOD is Anil Deshmukh. Sir, HOD and guide is Anil Deshmukh. Vata Jabishanda in introduction. Allergic conjunctivitis is most common type of eye allergy and is widely experienced by global populations. Hypersensitivity of body's immune system to these allergen is the main etiological factor. It is common in people who have other signs of allergic diseases such as asthma, eczema, high fever, rhinitis. In Ayurveda, allergic conjunctivitis is correlated with Vata Abhishanda. In sign and symptoms of allergic conjunctivitis, there is nistodha, that is irritation and foreign body sensation of eye, sangarsha, that is itching, alpashopha means mild chemosis, vishosheka bhava means feeling of dryness, raga, that is congestions of eye. My aim is to highlight the effect of Ayurvedic treatment in allergic conjunctivitis and study review of previous research work carried out in SST Ayurved College, Sangam. In material and method, clinical research work in allergic conjunctivitis, screen to assess the impact of Ayurvedic treatment modalities, data, find out, compile, and screen to assess, doses 1 time per day for 1 month. Total 30 patients completed the treatment. In inclusion criteria, patient presenting sign and symptoms of Vata Abhishanda like itching of eye, irritations, and foreign body sensation, dryness of eye, congestion of eye, that is redness. Patient having excessive outdoor work and which are exposed to allergens, other environmental factor. In exclusion criteria, patient those have viral and bacterial conjunctivitis, acute inflammation with complications, corneal ulcer, and superadded infections. Recently operated eye, patient those have atopic keratoconjunctivitis, venereal keratoconjunctivitis, giant papillary conjunctivitis. In observation, Trifalagrit used in the form of Ashwatthana, that is traditional method. Highly significant difference were found in the Sankarsha and Nistodha, while significant difference was found in Vishusheka Bhava and Raga. Help to relieve the sign and symptoms, show highly significant result with no adverse reaction. In result, Ashwatthana treatment protocol provide more significant result. Significantly effective and clinically safe. Highly significant difference were found in Sangarsha and Nistodha, while significant difference were found in Vishusheka Bhava and Raga. No adverse drug reaction were reported during treatment period, relieving most of the symptoms of allergic conjunctivitis. Case of papillary hyperplasia, it was insignificant. In discussion, Ashwatthana line of treatment in all IDCs. According to our Acharya, when Ashwatthana is instilled in eye, it passes through Netrasandhi, Sira, Nasika, Mukha, and expel the mala of Urvajatru. It provides relief in Nistodaha, Sankarshaha, Arusha, Daha, etc. So the ultimate aim of approach was to enhance the general immunity. No adverse effect reported, hence studied valid the potential of Ayurvedic treatment principle in the treatment of allergic conjunctivitis. In conclusion, Ayurvedic therapy is Ashwatthana treatment protocol, significantly effective, clinically safe, no adverse event of adverse drug reaction reported. Concluded that Trifalagrit Ashwatthana treatment protocol yield more significant result. Thank you.
Thank you, doctor. Next, I invite Dr. Suvarna Khandade for the paper and poster presentation. I invite Dr. Suvarna.
Yes, ma'am.
Doctor, please start the session.
Gmail ಅಂತ ಆಯ್ತು ಕೊಡಿಯಲ್ಲ ದವಾಯ್ತು ಕಲಿ Gmail open तिथे झूम वर जाऊ झूम
Is it visible, ma'am, screen?
Hello, Dr. Suvarna. Dr. Suvarna.
Is it
Yeah,
visible?
doctor.
No, not visible, doctor. Doctor, you have any problem with screen sharing?
Yes. Is it visible?
Yes, doctor. Now your screen
Yeah,
is
it's
visible.
now visible.
Please start the session, doctor.
Okay. Good evening, all. Myself, Dr. Suvarna Khandade. I am the PG second year student of Komar Nritya from Anna Sahib Dange Ayurved College, Ashta. And my guide name is Naresh Kumar Babasar. Here my paper presentation is on the diarrhea in children especially. It is the introduction of diarrhea. Diarrhea is the one most important cause of death in pediatric population as having the least surface area, and the diarrhea contributes to 40% death in age less than 5 years. So it is, I am taken this for study. Diarrheal diseases are the topmost in rank third position for the death of pediatric population. First on is on infection, 25% death causes. Second one on malnutrition, and third is the cause is the diarrhea in pediatric population for the cause of death. Diarrhea is the, according to allopathy, the definition of diarrhea is the passage of watery stool more than 3 or more than 5 times in 24 hours. Nowadays, rather than the number of stools, it is importance to the consistency and quantity of stool in the diarrhea, loose motions, which causes the dehydration. According to Ayurveda, there is definition according to Madhukosh, Madhavnidan. They have taken that Gudain Bahudrava Saranam Atisaram. It also suggests that there is the very watery and liquid consistency of the loose motions. So diarrhea is the one of the most cause of death in children, and it causes main two risk factors, that malnutrition and dehydration. Dehydration is the main cause of death in children because diarrhea is the risk factor in children as they having the lost surface area and mucosal area of the intestines. It causes the loss of electrolytes fluids more than the adults in 15% more quantity. These are the forms of diarrhea: secretory, osmotic, motility, acute, chronic, persistence, and intractable diarrhea according to its consistency. And according to our, this is the acute and chronic. According to etiological factors, these are the bacterial, viral, fungal, parasitic, and systematic causes of the diarrhea. Dietic, nutritional, and also induced drug induced or antibiotic induced diarrhea is also. According to Ayurveda, there are types: Vataj, Pittaj, Kaphas, Sanipathic.
and also included that are Amaj Atisar, Agantuj Atisar, which include Bayaj and Shokaj Atisar, and Pakwa Atisar. These are the types of diarrhea, Atisar in Ayurveda. In Atisar, there is the main cause of death in children is the dehydration. Dehydration is the depletion of the body fluid and electrolytes. Ayurveda is as comparatively taken as the dehydration part. Rasa is the prinanam, jevanam, lepan, sneham, dharanam, tuna, garbhodpadascha, dhatushta, shreshtham, karmam. These are the dhatus karma suggested by Vagbhat, and Prinan is the main karma of Rasadhatu. If Rasadhatu Kshay is happen, then Rasa Sushti, Prinanam, Rakta Sushti, Karomi, these karmas get decreased. As Sushrut said that Prinan, Tushti and Rakta Pushti are the karmas of the Rasadhatu. If Rasadhatu is going to be decreased, then these all functions also decrease, and portion of the all next dhatus should is going to be decreased. The grades of the dehydration are according to allopathy are the grade 1, grade 2 and grade 3 according to the percentage of the depletion of electrolytes and fluids, and according to sodium concentration in the dehydration there are 3 types: isonatremic, hyponatremic and hypernatremic. In isonatremic there is the equal loss of fluid and electrolytes. In hyponatremic there is the electrolyte loss more than the fluid, in which the extracellular fluid shifted to intracellular fluid, and in hypernatremic dehydration there is the fluid loss is more than electrolytes, so intracellular fluid shifted to extracellular fluid. In children's there are some criteria for examination for grade 1, grade 2 and grade 3 dehydration types. Normally, patient in mild dehydration, there is a child is very alert and normal conditions, which having mental status, pulse, BP, respiration, eyes are normal, and the loss of weight is also less than 3%. Body fluid is also very less, 50 ml per kg. But in moderate and severe, there is a depletion as the child is mentally irritable, thirsty in the moderate dehydration, and the pulse is maybe rapid or normal, but the BP is decreased due to fluid loss, and the skin turgidity is very slow. It is the less than time is the less than 2 seconds, and the mucous membrane of eyes is dry, tears also decrease, and the loss of weight is the 3 to 9%, and the loss of fluid is 50 to 100 ml per kg. In severe, there are the risk signs are increased. There are the dangerous signs seen as pulse is feeble, BP is unrecordable, acidic respiration is there, eyes are deeply sunken, and skin rigidity is slow return more than 2 seconds. Tears drop, urine out, and the body loss is more than 9%, 9 to 10%. And according to fluid loss in by weight, it is 100 more than 100 per kg. So these are the danger signs in the children's, which needs very in emergency treatment. Investigation should be done in the dehydration in childs, in the mostly not need to in mild dehydration, but in mostly moderate and severe dehydration, there needs the investigation for stool in examination, pus cells, RBCs, mucus, and microscopy for rotavirus infection, serum electrolytes for the potassium and sodium concentration, HB, CBC, ESR. Then renal functions needs to be urea, creatinine, urine examination for the gravity, electrolytes, and ECG may be needed in severe conditions for the hypo and hyper potassium concentration. The management of the diarrhea in the children's it should be in the earlier state, because the dehydration causes goes the children's in severe condition in very rapid condition. Management of diarrhea is the uses of drugs. Diet management should be important. Treatment of the complications, signs in emergency, symptomatic treatment should be done, and the management of dehydration is also done in rigorously. The Ayurvedic, according to Ayurveda, there is a chikitsa said to be first. It should be concluded that the Atisar is Amavastha in Amavastha or Niramavastha. Because in Amavastha, there is it should be first Nidan Parivarchan and the Sangrahan should be no done. No Ati Sangrahanam in the Atisar. According to Charkacharya said, Na tu Sangrahanam Deyam Purvam Atisarene. First should be given Langhan, Dipan, Pachan, and the drugs for the Pachan condition, Bal Chaturbhadra, Lavan Bhaskar Churna, Am Kutar Rasadi. And in Niram Avastha, it should be treated firstly to Laghu Samshodhan and Panak Yush Yog Kalpana should be given for the Pachan Kalpana and Dipan treatment. Gangadhar Churna, Karpur Ras, Takra Prayog, Ajakshir. Samshodhan Aushadhi should be given like Dhatkyadi Churna, Dadi Mahashtak Churna, Changeri Kruta, Balarkarasa, Jati Faladi Gutika. According to Charkacharya, these are the some drugs which should be treated according to doshavastha. In Vata Jatisar, Koch should be given Bilva, Magaj, Changeri, Dadim, Takra, Peya. In Pitta Jatisar, there is a Langhan should be done first in, and then Shaman Paschat, then Shaman should be given by Kutastvak and Ativisha. Kapha Jatisar should be first given Dipan Pachan drugs, and then Haritaki, Hinga, Savarchal, Senda, Vacha, Ativisha with the warm luke water. And in Tridoshas Atisar treated according to dosha pradhanatva. First should be treated by Kafaj Atisar, Kafaj like Lakshana, and then Pittas, then Vataj Lakshana. In Raktatisar, it seems like a Pitta Jatisar science. So it should be Jambul, Amra, Amalak Patra Swaras with milk and Gruta. In Amatisar, first should be given Langan and followed by Jatifal, Shvet, Jirak, Tankan, Churna with the curd. Bhesaj, Shoka Jatisar, in there should be need the moral support, and in this Atisar Prakar, Vat Prakop is there, should be treated like a Vata Jatisar. Pakwatisar also treated like a Pitta Jatisar by Kutastvaka Ativisha Churna with the honey. According to management, allopathy management plan should be done, and in also Ayurvedic treatment, this plan should be included because this is the important plan for dehydration correction. In plan B, there is should be oral rehydration therapy for mild and moderate. In plan B, there is a correction according to physical signs of dehydration for correction of existing water and replacement of ongoing losses, and then provision of normal daily fluid requirement. And in plan C, there are severe dehydration, so it should be started with the IV fluid intravenous included with the ORS, ORT. According to mine, there is need to be study. Still, there is the diarrheal management and how to recognize the arm and niram according to doshavastha. We should plus types of the atisar should be done, and then dehydration should be treated. We can use now instead of ORS in mild and moderate dehydration, we can try the Tandulato, Dadi Mayush or Panak, Lajamanda, Drakshadi Panak, and Drakshadi Panak line like watery included Panak Prakar, Lajamanda. It should be used, it can be used in dehydration for the dehydration correction in mild and moderate condition. Thank you.
Thank you, doctor. Next, I invite Dr. Ashwini Kalekar for presenting the paper on the topic Effect of Medhi Rasayana in geriatric healthcare with respect to mental health. I invite Dr. Ashwani.
Hello. Hello.
Hello, doctor.
Okay, ma'am.
Doctor, please start. Your audio is clear. Please share the screen.
Hello, ma'am. Ma'am, actually, I'm not able to share my
Hello,
screen. I need some time. Hello.
Hello.
Hello, ma'am.
Hello, doctor.
Ma'am, I need some time. I'm not able to share my screen actually.
Okay, doctor. Please try it once again. If it is working, you can present next.
Ma'am, I will present next time.
Excuse me. What, doctor?
Ma'am, I will present next. I need some time, ma'am. Hello.
It's not clear, doctor. Can you repeat once again?
Ma'am, I need some time, ma'am. I will present next, ma'am. Actually, I'm not able to share my
Okay,
screen.
sure.
Doctor, don't worry,
Sure,
doctor. Are you ready? Ready to
Okay, doctor.
ready for the presentation?
No, sir. Actually, I'm not able to share my screen.
I will share the screen for you, doctor.
Yeah. That will be good.
1 minute, doctor.
Good evening, everyone. Am I audible?
Yes, doctor. Audible.
Yes, doctor.
Yes. Good evening, everyone. Myself, Dr. Ashwini Palekar from SMBT Ayurved College. My guide name is Dr. Hiraman Manamastu, sir. Today I'm going to present my topic, effects of major science in geriatric healthcare with special reference to mental health. First, introduction. Geriatric is a branch of medicine concerned with the care and treatment of elderly. In human body, dhatus get deep advances due to prolonged structural and functional changes. Geriatric healthcare is the process of planning and coordinating care of elderly with the physical and mental impairment to meet their long-term needs, improve their quality of life, and maintain their independence for as long as possible. Elderly people, they are highly prone to mental morbidity due to aging of brain, problem associated with the physical health, cerebral pathology, socio-economic factors such as a breakdown of the family support system and decrease in the economic independence. Many psychiatric complications like dementia, delusional disorder, hallucination, depression, anxiety, personality alteration, Alzheimer's disease, and age-related neurological problems can seen in elderly people. Concept of aging in Ayurveda. According to Ayurveda, they are aware about the facts of aging and related disorders. They have given the term Jara as a synonym to the disease process. Next, hallmark of brain aging. In modern human brain shrinks, resulting in reduction of white and gray matter and enlargement of ventricles. Also, the dysregulation of calcium and calcium plus hemostasis, alteration of neuronal network activity, and oxidative damage. Also, the impaired DNA repair, impaired adaptive stress response signaling. Yes. Next, mechanism of brain aging according to modern. A number of changes takes place in the brain during aging at a molecular, cellular,
cells may succumb to neurodegeneration. There is a considerable loss of neurons, reduced synthesis of neurotransmitters like glutamate, acetylcholine, dopamine, which leads to formation of plaques and tangles, accumulation of lipofuscin. That is the yellow-brown pigmentation granules, which are residue of lysosomal digestion in nerve tissues, resulting in the breakdown of nerves. Associated condition accelerating the process of brain aging include vitamin B group deficiency. That is, B vitamin protects brain function by regulating energy metabolism. And high level of inflammatory cytokines, high C-reactive protein, deficiency of dietary antioxidants like acetyl L-carnitine. These also the responsible for the brain aging. Also, the hyperglycemia is also the having the adverse side effects on the hippocampus and thus in the raises the risk of Alzheimer's disease. Concept of aging in Ayurveda. Ayurveda defines mental health as a state of mental, intellectual, and spiritual well-being. It is well established that this state of mental harmony declines the advancing age leading to various degenerative conditions. According to Acharya Sharangar, loss of virility, strength, and cognitive power is progressively noted from sixth decade of life. According to next, According to Sharangar, there is a specific loss from the body according to age. At the age of 0 to 10, there is a loss of balya, and the suitable vaccine is Kashmiri. At the age of 11 to 20, there is a loss of buddhi, and the suitable vaccine is Bala and Ashwagandha. At the age of 21 to 30, there is a loss of chavi, that is luster, and the suitable vaccine is Amali. At the age of 31 to 40, there is a loss of Medha, that is intellect, and the suitable vaccine is Shankapushti and Jyotishmati. At the age of 41 to 50, there is a loss of Swaka, that is luster of steel, and the suitable vaccine is the Bhingaraj and Somaraj. At the age of 51 to 60, there is a loss of Drishti, and the suitable vaccine is Saptamrut Loa. At the age of 61 to 70, there is a loss of Shukra, and the suitable vaccine is Atmagupta and Munjato. At the age of 70 to 80, there is 71 to 80, there is a loss of Vikram, that is physical ability. And at the age of 81 to 90, there is a loss of Buddhi, that is thinking ability. And at the age of 91 to 100, uh, there is a loss of Karmendriya, that is locomotion. Neurological disorders in Ayurveda. According to Ayurveda, there is this Ayurveda has described various kind of mental disorders like Unmada, Apasma, Asatva Abhinivesh, Bhaya, Harsha, Shoka, Udvega, and Avasada. Uh, Rasayan therapy in Ayurveda. Rasayan therapy is a method to control or slow down or arrest the aging process in human beings during the degenerative phase of life, acts as a micro. So, three basic mechanisms. First is rasa enhancing or direct nutrient effect. Second is Agni enhancers or promoters of digestion and metabolism. Third is Protasta purifying agents or promoters of microcirculation and tissue perfusion. Jara Chikitsa is known as Rasayan Chikitsa as said by Acharyas. Some of these rasayanas are organ and tissue specific, and those rasayanas are specific to brain tissues are called Medya Rasayan. In Rasayan drugs, the effect of Rasayan drugs, it will decrease the inflammation, decrease the oxidative stress, increase the free radical scavenging antioxidant effect, increase the immune modulation, immune stimulation, increase the adaptogenic effect, increase the antioxidant enzymes, decrease the mutagenesis, DNA damage, and DNA clastogenesis, and decrease the lipid peroxidation. Major rasayana. Major rasayana are a group of medical plants with multiple benefits, specifically to improve memory and intellect. These drugs promote the intellect, that is B, retention power, that is Dhriti, memory, that is Smriti. Major rasayana drugs are known to have specific effects on mental performance by promoting the function of buddhi and manas by correcting the disturbance of rajas and tamas. This helps the mental patient to get relief from stress, anxiety, and depression. In Charak Samhita, there are four drugs are mentioned as major rasayanas. First is Yashtimadhu Churna, second is Mandukaparani Swaras, third is Shankapushpi Kalka, and fourth is Guruchi Swaras. Next. The ingredient of major rasayana. Uh, First is major rasayana drugs. Major rasayana drugs act as two types. First is Shitavirya and Madhura Vipak, and second is Ushnavirya and Tikta Rasa. Shitavirya and Madhura Vipak, it promotes the cough and enhances Dharan Karma, that is retention of cognition. For example, Yashti Madhu, Brahmi, Shankapushti, etc. And Ushnavirya and Tikta Rasa, it promotes the Pitta and enhances uh, Grahana and Smarana, that is grasping power and memory. For example, Guruchi, Vacha, and Jyotishmati. The major drugs. First is Mandukaparni, synonyms Manduki, Divya, Manduk, Mahaushadhi, etc. And Doshakarma is Kapha, Pitta, Shamak, Rasa, Pitta, Guna, Laghu, Virya, Shita, Vipak, Madhura. Second is Yashti Madhu. The synonyms are Yashti Madhuk and Klita. Doshakarma are Patra, Pitta, Shamak, Rasa, Madhur, Guna, Guru, Snigdha, Virya, Shita, Vipak, Madhur. Guruji, the synonyms are Amruta, Madhuparni, Chinnamula, etc. And Doshakarmas are Vidosha Shama, Rasa, Tikta, Kashaya, Guna, Guru, Snigdha, Virya, Ushna, and Vipak Madhur. Shankapushpi, the synonyms are Kshirapushpi, Mangalya Kutuma, Doshakarma, Vatapitta Shama, Rasnigdha, Pichila, Virya Shita, Vipak Madhur. Next. Mode of action of Yashti Madhu. According to Charak Samhita, it is Jivaniya, Sandhaniya, and Varnya Kantya. Karma of Yashti Madhu. Yashti Madhu is the Vatapitta, Balakruta, Varnakruta, Swarya, Shotahara, and Kashayahara. And the chemical constitution is glycerin, glycerinic acid, isoflavonoids, chalcones, etc. And effect of Yashtimadhu is effect on learning and memory. That is the glabridin is a potential candidate for memory improvement and can be used in the management of Alzheimer patients. Aqueous extract of Yashtimadhu also have an antidepressant effect. It also has an antioxidant property which gives the neuroprotective effect, resulting in reduced brain damage and improved neuronal function. Next, mode of action of Guruji. According to Charak Samhita, it is Vayastapan, Rasayani, Balya, Agni Ripani, Medhya, and Tridoshahara. Guruji is known to be a rich source of trace elements which act as an antioxidant and protect cells from the damaging effect of oxygen radicals generated during the immune activation. And the chemical constitution of Guruchi is alkaloids, diterpenoid, lactones, glycosides, steroids, etc. And the effect is immunomodulator activity, aqueous tinospora extracts were able to increase the leukocyte count significantly. It has a anti-stress and tonic activity also. The plant of Tinospora cordifolia brought about a good response in children with moderate degree of behavioral disorders and mental deficits. It has also significantly improved the IQ level. Next, mode of action of Shankhapushpi. According to Charak Samhita, it is a major Swarakarni Rasayani, Unmadagna, Nidrajana, and Majjadhatu Rasayan. It contains carbohydrate D-glucose, maltose, rhamnol, sucrose, starch, protein, amino acids, and the alkaloids, convolene, uh, convolamine, etc. Whole plants shows memory enhancing, anti-anxiety, and CNA depressant activity, and significantly increases the scavenging activity of free radicals by its bioactive constituents, which helps to attain antioxidant defense mechanism. It also has an anti-convulsant property and showed the significant elevation in cell survival. Uh, it reduced the alcoholic withdrawal anxiety and increased the cortical hippocampal GABA levels. Mode of action of Mandukaparni. According to Ayurveda, it is the Vayastapan, Kapha Pitta Shama, Rasayan, um, Medhya Yuddhikar, and Sarva Pathya. The active constituents are saponins, flavonoids, tannins, vitamins, potassium, magnesium, and sodium. It shows sedative and anti-anxiety properties. Cognition and antioxidant properties. It is known to revitalize the brain and nervous system, increase attention span and concentration, and to combat aging. Anti-epileptic effect. It increases cerebral level of GABA. It also has an antidepressant effect. Thank you.
Thank you, Dr. Ashwini.
Thank you.
Thank you, doctor. Next, I invite Vaidya Kavita Gangadhar Ambe for both paper and poster presentation. I invite Dr. Kavita for paper and poster presentation.
Yes, ma'am. Hello everyone. Good evening to everyone. I am Vedya Kavita Ambe. Here I am presenting paper on topic relation between Agni and Pitta, a review under the guidance of Professor Brijesh Mishra sir, HOD of Sanhita Siddhant Department, Shri Ayurved Mahavidyalaya, Nagpur. Introduction. All diseases are occurred due to Mandagni. If Mandagni is the cause of disease, then treatment purpose we need to understand the term Agni. Unless we know the normal physiology, we can't identify the pathology due to Agni Dushti. For this purpose, thorough study of Agni is needed. Characteristics of Agni somewhat resembles to characteristics of Pitta dosha. Some Acharya said that Pitta and Agni are same. If both are same, then what is the need to explain it separately? Pitta dosha is responsible for digestion. Also, Agni is the energy that is an important factor for this process. However, there is a difference between Pitta and Agni, which has been explained by both Charak and Shushruta. Aim of my paper is to discuss and elaborate relation between Agni and Pitta. Objectives are to study the Pitta, to study the Agni, materials and methods. This paper is based on textual review. Material related to Agni and Pitta was collected from Charak Samhita, modern texts, and various websites to collect information on the relevant topic were referred. Agni, definition of Agni, the fire
Doctor,
element.
hello.
Hello.
Doctor, your screen is not moving, doctor.
Okay. Hello, sir. Now visible, sir?
Visible, doctor, visible. Please continue, doctor.
Agni, definition of Agni is the fire element present in body in microscopic level is called Agni. Appearance, the exact structure of Agni is not known and its function being very important, it is compared to God. That is Shri Sutra 35 mentioned, Jathara Bhagavana Ishwara Agnusya Pachaka. These are the synonyms of Agni. Types of Agni. There are Trayodasha Agni mentioned in Samhita. Jathar Agni, Dhatva Agni, Bhautik Agni. Dhatva Agni are 7 and Bhautik Agni are 5. So total is 13. There are the references in Samhita. Agni. There is 4 type of Agni mentioned in Charak Viman Sthan 6. Rogani Viman. Tikshna Agni. The nature of Tikshna Agni is Sarva Apachara Saha. मंद अग्नि अपचार असह विषम अग्नि सम लक्षण विपरीत लक्षण अस्तु सम अग्नि खलोपचारतो प्रकृति अपद्यते अनपचारस्तु प्रकृतावतिष्ठते. In description of type of pitta, Acharya Sushruta mentioned pitta with special reference to Agni as follows: Pachak Agni, Ranjak Agni, Alochak Agni, Sadhak Agni, Rajak Agni. Function of Agni is mentioned in Grahani Dosh Chikitsa, Charak Chikitsa 15. Strength, color to skin, maintains body temperature, health, keeps the person active, courage, keeps the person alive. Pitta, the Nirukti of Pitta is Tapasantape. That word Tapasantape means creation of heat or process or color change, etc. Composition. Although Pitta has the composition of 5 elements, fire element is predominant. Properties of Pitta dosha. Pittam Sasneva, Tikshna Ushnam, Laghu Visram, Saram Dravam. Synonyms of Pitta. In this, Pitta is also called the Agni. Types of Pitta. There are 5 types of Pitta: Pachak Pitta, Ranjak Pitta, Alochak Pitta, Sadhak Pitta, Bhrajak Pitta. Agnirev Sharira Pittantargata Kupita Pitta Shubhashubhani Karoti Tadyata Paktim Apaktim Darshanam Adarshanam Matra Amatratvam Ushnah Prakruti Vikruti Varno Shoryam Bhaya Krodham Harsha Moha Prasadam Ivatya Adini Cha Prani Dvandaniti. There are the 5 types of pitta and their function is mentioned in this shloka in Charak Sutra 12. Matakalakali Adhyay. How Agni is different than pitta? According to Charaka, Agni is in the form of energy and it works through the medium of pitta. When it is functioning properly, it plays an important role in digestion. When it becomes abnormal, then this same Agni is the reason for indigestion. Example, if hot ghee burns our finger, we say that the ghee has burned the finger. But in fact, Agni inside ghee is responsible for the burning. In colitis, secretion of pitta increases while Agni decreases. समदोषः समाग्निश्च समधातु मलक्रिय प्रसन्न आत्मेन्द्रिय मनाः स्वस्ति इति अभिधीयते. Charak Sutra 15. According to this statement, we also differentiate between pitta and Agni. Yes, ma'am.
Hello, doctor. Is your slide is moving?
Yes, ma'am.
Still in the Agni portion.
Okay.
Okay, doctor.
Is it visible, ma'am?
Yes, doctor. Slide is visible.
Yes, doctor, please continue.
Sushruta critic Dhalanacharya said that ghee palliates pitta but evigorates Agni, sheep's milk and flesh increases pitta but suppresses Agni. Taking a nap during the day also increases pitta but decreases Agni. Discussion. Jata Agni, the main Agni inside the body, is compared to God and cannot be shown, but Pitta can be seen with its specific color, odor, and pungent taste, etc. Agni means hot and penetrating Ushna and Tikshna properties, and all digestive and metabolic functions. Hot and penetrating capacity is also main property of Pitta. But properties like little oily, fluid, and unpleasant smell also exist in Pitta. Digestion is the main function of Pitta, but one can also see other functions of Pitta. Agni and Pitta are two different substances but have an affinity for each other. Agni is hot and is the energy inside Pitta. Agni and Pitta together with their hot and pungent properties helps in digestion. Besides the being hot, Pitta is a liquid which is not in the case of Agni. There is the conclusion. This is the small attempt on review of relation between Agni and Pitta. After a detailed discussion of Agni and Pitta, it has been observed that all the theory regarding Pitta and Agni has its own importance, and it is very difficult to conclude on a single point. Pitta and Agni are the same, where in accordance to their build, they differ from each other. Acharya Shushruta has used the term Agni in the context of Pitta, but what conclusion that can be drawn is Agni and Pitta are same as for the treatment is concerned, but differ at other point. Agni is inside the Pitta, that is, Agni resides in Pitta, but Agni is not exactly Pitta. There are several places where Pitta and Agni entirely differs to each other. Acharya Charka has mentioned various type of food which we ingest is digested by its own Agni, Bhutagni, which is activated and enhanced by Jataragni. Further, it is metabolized by Dhatavagni to provide body strength, completion, and happy life and energy. These are the references. Thank you. Now I am presenting poster on topic Nidra, one of the most important pillar of lifestyle. Introduction. Sleep is the one of the most misunderstood and mysterious phenomenon in nature. Sleep evolved millions of years ago as a life support function, and the fact that is persisted itself means it is not a mistake of evolution. Even microbes and plants have some form of circadian rhythms with alternating active and resting states. Man is the only species which deliberately deprives itself of sleep for no apparent gain, thinking it is a wasteful, lazy activity to be replaced with work or a workout. In laboratory experiments, within a few weeks of sleep deprivation, rats started losing weight, can no longer maintain their body temperature, and die. Humans deprived of sleep for a long period start hallucinating and develop something like a psychosis. Sleep deprivation kills you earlier than food deprivation. Aim to study the importance of Nidra in the perspective of important pillar of lifestyle. In Ayurveda, Trayostambha are mentioned. Trayostambha are the subsidiary pillars which support the body throughout the lifetime by providing the qualities like Bala, Varana, Upacha, etc. They are considered as subsidiary or secondary as a principal pillar of life, are the three doshas. But their importance in normal function of the body cannot be overlooked. The Trayostambha are Ahar, Nidra, and Brahmacharya. Every one of those deserves due to importance because these factors are concerned with the essential needs of living system, and our indulgence or total subsistence of any of those is also harmful to life. The ahara is especially concerned with the energy production and maintenance of living tissue. The nidra is that the one which offer complete relaxation to the body and mind, and there is a restore the potential of the individual. The brahmacharya is the concern with disciplined mode of sexual life and reproduction. In Charak Sutra 21 अष्टोनिंदिता अध्याय निद्रा एत्तम सुखम दुःखम पुष्टिम कार्शम बलाबलम वृषता क्लिबता ज्ञानम अज्ञानम जीवितम नच means proper sleep gives us happiness, nourishment, strength, virility, knowledge, life, and improper sleep gives us mysterious imagination, weakness, sterility, ignorance, and death.
We can see in a first image, after 8 hours of sleep, person feel happy and skin is glowing, and after 4 hours sleep, there is some uh, hello, I'm audible.
Yes, doctor.
Sleep deprivation is a sure recipe for obesity and weight gain because sleep plays a major role in the regulation of appetite and feeding. Other animals deprive themselves of sleep only when angry and foraging for food. So when sleep deprived, our brain and body misinterpret it as a signal of starvation and makes you feel hungrier, reduces satisfaction and promotes weight gain. Not just that, is even encourages you to choose unhealthy food over healthy ones. Sleep and the heart is during sleep that the heart gets some respite, blood pressure and heart rate settles down. It is no wonder that the day after daylight saving time starts and millions of people lose an hour of sleep. There is a sharp spike in the incidence of heart attacks and strokes. Discussion. Ayurveda has recognized Nidra as one of the most important dimension of health associated with happiness and good health, and is an outcome of relaxed mental state. Altered habits of sleep will cause many mental illness and physical changes. Balanced sleep is the key to happy and disease-free life. Tips for good sleep: have a regular schedule. Go to sleep and wake up at the same time every day. Start to relax before bedtime. For example, try meditation, journaling, or light stretches. Start turning down the lights and avoid exposure to blue light, as in iPads or mobiles, before bedtime. Expose yourself to bright sunlight soon after waking up. Thank you.
Thank you, doctor. Next, I invite Dr. Meenu Swamida to present the paper on the topic Dasaushadhi Prayoga in Arbuda.
Ma'am, am I audible?
Yes, doctor.
My screen is, you can see now, ma'am.
Visible, doctor.
Yes,
Screen is visible, doctor.
Namaste, my name is Dr. Meenu Swamina. I'm going to do the presentation on Dasaushadhi Prayoga in Arbuda under the guidance of Dr. R.S. Sir, BMK Ayurveda Mahavidyalaya. Background: cancer is the leading cause of death worldwide, accounting for about 22% of mortality as per WHO. Ayurveda described cancer as inflammatory or non-inflammatory swelling and mentioned them as Grandhi or Arbuda. Arbuda is one of the surgical diseases and was explained in detail by Acharya Susruta, the pioneer of surgery. According to the modern medicine, cancer is the uncontrolled growth of abnormal cells. Gatra Pradeshe, Kojit Eva Doshaha, Samurchida Mamsam Abhipradushya, Vrittam, Stiram Mandarujam Mahandad, Analpamulam, Chirat Vriddam Apakam, Kurvandi Mamsopajayam to Shobam, Tam Arbudam, Shastra Vido Vadandi. Materials and methods. Cancer word derived from the Greek word karkinos, means crack. Appearance of large prominent vein surrounding the growth, encircled by mass of close of crack. So we can divide the cancer into two types, benign and malignant. And as per the origin, we can divide into from those originating from the endoderm is called as carcinoma, from mesoderm is called sarcoma, WBC and monocyte macrophage system, it is called leukemia or lymphoma. The benign carcinoma is that which accumulates cells which transform to reproduce multiple cells in limited with the tissues of the origin. The malignant carcinoma will go with four mechanisms, that is initiation event, promotion event, conversion event, and progression event. That is, in the initiation event, the stem cells, by the effect of the carcinogens, chemicals, UV rays, will be alter the DNA structure and change to initiated cells. These initiated cells in the promotion stage get proliferated or stimulated to the precancerous cells. These precancerous cells converted to the cancer cells, which change is irreversible. irreversible. These cancer cells get changed into the metastatic cell, which is the hallmark of the cancer, or metastasis is the establishment of the tumor at distant site. So as per Ayurveda, we can tell in malignant tumor, there will be primary prasara, secondary prasara, sthana samsraya, and bhedana. According to Ayurveda, we can divide this cancer or arbuda into Vata, Pitta, Kapha, Raktaja, Mamsaja, and Medoja. The Samprapti. Due to Nidana Sevana, Nija Karanas lead to Agni Mandya and Agamtuja Karanas like Mushti Praharadi lead to Datvagni Mandya. These all in the Pragoba stage goes Dosha Pragoba, Rekta Dushti, Mamsa Dushti leading to Sira Sampidya, Sroda Dushti Sangha and Sira Grandi, Kavaigunya, and in the Vekta Vasta there will be Arbuda, Rekta Arbuda and Mamsa Arbuda. Treatment in Chigilsa, there will be Aushadha Chigilsa, Shalya Chigilsa, and Anushastra Chigilsa. In Aushadha Chigilsa, Staniga and Sarvadehiga, that is Pragadishta, Naistiga, Roga, Shanti, Rasayana Chigilsa comes under this. In Anushastra, Agni Karma, Shari Chigilsa, and Rekta Moshana comes in that. Even the dietetic modification, meditation, all comes under Aushadha Chigilsa. The specialty of Rasoshadis are, they can be given in all stages, including palliative care. Here I am explaining some peculiar Rasoshadis told by the Rasacharyas, which can be given as Abhyantara Rasayana and also Bahya Prayoga. As we know, the main drugs we are giving in Arbuda like Parada, Gandaga, Vasanava containing formulations are there. And even Abraga Bhasma, Tutta Bhasma, Hiraga Bhasma, Tamra Bhasma are also giving in Arbuda. So the Rasoshadis for Abhyantara Prayoga, like Arbudohara Rasa told by Rasarakna Samuchya. It contains Parada along with the various herbal ingredients. And the dosage is about 125 mg only we are giving. And another specialty is like Netrashini Rasa told by Rasendra Sara Sangraha. It contains Abraha, Loha and Gandaga. Along with that, it contains Rasanjana also. The specialties is specifically indicated for Arbuda only. The dosage is 250 mg only. Then Raudra Rasa is told by more than 5 acharyas in Rasendra Sara Sangraha, Rasendra Chindamani, Rasa Chandramshu, Rasa Raja Sundara. In Rasa Kamadenu also told about Raudra Rasa. The specialties it contains Gandaga and Parada along with the herbal drugs. Another thing is Saptamrata Loha told by Chakradatta. Its main ingredient is Loha only. The dosage is 250 mg we are giving in that. And then Bharat Beshija Reknagara told about Tala Bhasma and Trayushnadi Gudiga. It containing Haratala. Since it contains Haradala, the dosage is from 60 mg to 125 mg we are giving. Vajra Bhasma told by Rasamrita, its dosage is only 8 mg because it containing Hiraga, Rasasindura, Manashila, Gandaga and Haratala. Among this, according to Sahasra Yoga, Chandraprabha Gugulu is told containing Bitalavana, then Gandhira Rasayana, Madhusnuhi Rasayana, Agnigrada, Agastyagrada. These all can be given up to 12 grams as a Rasayana. As Bhagya Prayoga, Kataga Phaladi, Anjana, like different formulations are there. When we go through these formulations, we can see most of the formulation contain Mana, Shila, Shanga, Saindava as ingredients. Even Churnanjana by Vangasena containing Mana, Shila, Shanga and Saindava. And then Surya Prabhavarti by Rasarakna Samuchaya. Arbuda Leba by Sahasra Yoga. The peculiarity of Upodika Leba by Vangasena is the only 3 ingredients of Upodika Leba is Saindava, Takra and Kanchi. So the result, Ayurvedic preparation can act as an adjuvant or a co-therapy along with the chemotherapy or radiotherapy. It is also helpful in post-surgical care. Ayurvedic medicine helps to minimize the side effect of these therapies. The administration of herbs and rasayana in the form of plasma-based medications embark to be effective in controlling different forms of malignant growth. Malignancy, which has its origin in tumor of different kinds, is effectively brought under control with the dissolution of the same. It generally transforms into the shape of irregular mass to be absorbed by the circulatory system. Non-elements such as gold, sulfur, copper, and zinc are made use of. Even the ash of natural gems such as pearl, ruby, and diamonds are used in the preparation of medicines. Mercury, after purification, when amalgamated with certain herbal drugs, give excellent result in cancer cure. The main example we can tell is Raudra Rasa only. Discussion: the human body composes of musculoskeletal system and water. The charring remnants of the musculoskeletal system system is ash, and ash and water both are inorganic components. Rasoshadis are recommended in alpa solpa matra, and since these are inorganic in nature, most often they are tasteless, hence no possess any problem of palatability and acceptability. Added to this, the metals reduced to plasma will directly enter into the blood circulation by surpassing the first pass mechanism, exerts its action at the target organ, and thereby relieve the ailment, and on practicing of these regimens regularly will make the body stronger. Rasatrevias act as rasayan and strengthens the normal cells and induce programmed cell death of cancer cells. It also modulates tumor microenvironment, leading to reduced tumor burden. We have to ensure the standard purification of Rasatrevias and easy method of preparation of Rasoshadis. So the conclusion, cancer treatment through Ayurveda does not only focus on area of malignancy, but on the entire system has the whole body crust return to harmony for the disease to be traced permanently and not occur elsewhere. This can be effectively done by Rasoshada Chikitsa. Ayurveda encompasses the use of multiple compound formulation known as Rasakalpas to provide a near immediate effect. However, a detailed study is needed to check the pharmacodynamic as well as pharmacokinetics of these Rasakalpas. Thank you.
Thank you, Doctor.
Thank you, ma'am.
Next, I invite Dr. Shivakanya for presenting the paper on the topic role of Ayurvedic drugs in skin diseases. I invite Dr. Shivakanya.
Good evening, everyone.
Good evening, Doctor. Doctor, please share the screen.
Hello, doctor. You have any problem with screen sharing?
Yes, sir.
Don't worry, doctor. I will share for you.
Okay, thank you.
Doctor, please start the session.
Good evening, everyone. Myself, Shivkanna Gade, second year PG student of Dravyagun, CSMS Ayurved College. I'm presenting paper on role of Ayurvedic drugs in skin diseases. What are the skin diseases? Kushta is a common condition explained in Ayurveda, which covers wide range of skin diseases due to unhealthy lifestyle, unhealthy diet habit, stress, immunological response, acne, melasma, eczema, psoriasis, urticaria-like skin diseases are most commonly seen. Etiology of skin diseases in Ayurveda. As per Ayurveda, skin diseases occurs due to imbalance of three dosha, vata, pitta, kapha, and it affects tvaka, skin layer, rakta, blood, mans, flesh, ambu fluids of the body, causing skin disease of various presentation. Treatment of skin diseases. To treat skin diseases as per Dosh, Dushti and Dhatu involved, line of treatment includes external application and internal medication. In acute and chronic diseases, external application involve lepan, dhupan, dhavan by medicated oils decoction. In internal medication, diet, oral medication, medicated sneha, pan, kashai are given and panchakarma also done. External application includes lepan, for lepan, varna lepa, for example, Rakta Chandanadi lepa. For dhavan, infected skin is washed by Triphala path or nimba. For dhupan, steam given by nimba or sarshap. Oral medication, Haridra Khanda. It is effective herb useful in skin allergy. Mahamanjishtadi Kashaya. Sarivadi Ras. It is used as a blood detoxification. Triphala Gruthapan. Panchakarma also done detoxification. Vamana therapeutic emesis, Virachan, purgative therapy, Raktamokshan by leech. Basti enemas are given to improve skin health. Nasya nasal drops of Anutel also given. Most common drug used for external and internal applications are Nimba, aloe vera, Haridra, Manjishta, Chandan, Currant, Tulsi, Khadir. Thank you.
Thank you, Doctor.
Thank you.
Next, I invite Dr. Aishwarya E.K. for the presentation. Dr. Aishwarya.
Yes, ma'am. Yes. Am I audible?
Yes, ma'am, audible.
Yes, Doctor.
Good evening, one and all. Myself, Dr. Aishwarya, final year PG scholar, SDM College of Ayurveda and Hospital, Hassan. I'm here to present my topic on Sandarpanota Vyadhi with special reference to childhood obesity. Coming to introduction, humans have the capacity to store energy in adipose tissue, allowing improved survival in times of famine. Simply, obesity results from imbalance of caloric intake and energy expenditure. Incremental but sustained caloric excess result in excess adiposity. It's a result of interplay among genetically determined body habits, appetite, nutritional intake, and physical activity. Humans innately prefer sweet and salty foods and tend to initially to reject bitter flavors common to many vegetables. Body mass index, BMI is calculated by weight in kg divided by height in meter square. Overweight is considered as if BMI is in between 85 to 95 percentile. Obesity is more than 95 percentile. During childhood, levels of body fat change beginning with high adiposity during infancy. Body fat levels decrease for approximately 5.5 years until the period called adiposity rebound, when body fat is typically low level. Adiposity then increases until early childhood. Coming to endocrine and neural physiology regarding obesity, monitoring of stored fuel and short-term control of food intake occurs through neuroendocrine feedback loops linking adipose tissues, GI tract, and CNS. Adipose tissue provides feedback regarding energy storage levels to brain through adiponectin and leptin. Adipose tissue secretes adiponectin into blood with reduced response to obesity and increased response to fasting. Leptin is directly involved with satiety. The neuroendocrine control of appetite and weight involves a negative feedback system balanced between short-term control of appetite and long-term control of adiposity. This is regarding childhood obesity and common complications. Coming to intervention, treatment includes target behaviors, self-monitoring, goal setting, stimulus control, and promotion of self-efficacy and self-managing skills. Behavior changes associated with improving BMI include drinking lower quantity of sugar, sweetened beverages, consuming higher quality diets, increasing exercise, decreasing screening time, and self-weighing. Because obesity is multifactorial, not all children and adolescents will respond to the same approach. Increasing physical activity without decreasing caloric intake is unlikely to result in weight loss. However, aerobic exercise has shown to improve metabolic profiles in obese children and adolescents. These are the prevention, proposed suggestion for preventing in obesity like pregnancy, postpartum and infancy case in families, schools, healthcare providers like. Coming to Staulia, Acharya Charaka has included Staulia under Ashtanindita Purishas. A person having excessive mamsa and meda leading to looseness of hips, abdomen and breast has been recognized as Adistula. Medas, just like Kapha is made up of Prithvi and Mahabhuta, characterized by Snigdha, Guru, Pichila, Mridu, Sandra and Ghana. Snehana, Swedana, Dhridatva, Asti Pushti are the main functions of Medadadu. This is the pathology behind Staulia. Due to the Ahara Sevana, Nidanas, Vada Pragobha will be there. It will lead to increased Agni, that is Deepta Agni. Therefore, increased Kapha and Medo Dadu, reducing choice of diet and lifestyle leads to the Ama formation. There will be Srodha Virodha, leads to Meda Dadu Vriddhi. This is produced as Staulia. And Nidana of Staulia, Avyayama Diva Supnat Shleshma Ahara Sevina, Madhurana Raso Praya Shleshma Medo Vivardhati. There are many treatment for Staulia, like single drug therapy, preparations, yoga. In single drug therapy, we can give Guduchi, Musta, Vidanga, Nagara. In preparations, Trifala Prayoga we can use, and Yavakshara, Takra, Ishta, Trifala Guguru. Almost all Trifala formulation we can give for Staulia preparation. And regarding yoga, Surya Namaskara, Bhujangasana and Paschimottanasana is advisable. And these are the foods to be included for Staulia patients like rice, chapati, bread, pasta, poha, like dal, sprouts, salads, seasonal and green leafy vegetables, milk, curd, paneer, soup, salads, fresh local fruits, dry fruits and oil seeds, egg and fish. And to be excluded like cold drinks and packaged foods, chips, chocolate, coffee, pastries. And coming to conclusion, social changes and worldwide nutrition transition are during the obesity epidemic. Obesity affects both physical and psychological health like depression and anxiety. If the obese babies are turns to adult, it is more risk for their health like cardiovascular system disorder and regarding diabetes and atherosclerosis, many diseases will occur. If we are preferring good diet and lifestyle, it is good for their health also. In Ayurveda also one concept is there like Matravada Ahara Lashana. We can prevent the Staulia disease. Thank you.
Thank you, Dr. Aishwarya. Next, I invite Dr. Abeksha for the paper presentation on the topic Management of Psoriasis, a review. I invite Dr. Abeksha for the presentation.
Hello. Good evening, everyone.
Hello, doctor.
Am I audible?
Yes, Doctor, audible.
Yes, doctor.
Is my screen visible?
Visible, Doctor.
Good evening, everybody. Vaidya Apeksha Gunde is here from Sumati Bai Shah Ayurvedic Mahavidyalaya, Pune. PG Scholar Agattantra final year. Today my topic is Ayurvedic Management of Psoriasis, a review. Psoriasis is a chronic inflammatory immune-mediated proliferative disease. Prevalence of psoriasis in countries vary from 0.09% to 11.4%. In addition to the involvement of skin, inflammatory arthritis may develop. In Ayurveda, all skin diseases are explained under the Kushta Roga, which is again divided as Mahakushta and Kshudra Kushta. The clinical presentation of psoriasis is almost similar to the Ek Kushta explained as in Ayurvedic text. There is no as such permanent line of treatment in modern medicine which can completely cure psoriasis without any adverse effects. So, there is need to develop an Ayurvedic management for psoriasis, and which is done by Nidan Parivarjana, Shodhana, Shamana, Yoga, and by following Tathyapathya. Types of psoriasis: plaque psoriasis, pustule psoriasis, nail psoriasis, gutted psoriasis, flexural psoriasis, and erythrodermic psoriasis. Common signs and symptoms. First one is Asveda, reduced sweating. Mahavastu, which means extended skin lesions. Third one is Masya Shakalopama, scaling of skin similar to the scales of fish. Krishnavarna means blackening of the part. Rukshata, where there is a dryness of skin. Pinkish discoloration. Pruritus. Psoriatic arthritis includes both psoriatic lesions and inflammatory arthritis-like symptoms. Causative factors. Environmental factors. Mechanical injuries, UV X-rays, UV rays, prescription drug use, psychological stress, smoking, and various infections. Dietary causes. Diet plays an important role in etiology and pathogenesis of psoriasis. Third one is genetic factors. Research studies found that there is a clear genetic cause in psoriasis. Immunological factors. Psoriasis is autoimmune disease. Increased T cells activation can cause psoriatic lesions. Aharaj hetu. Viruddhahar factors can cause psoriasis. Viharaj hetu. Excessive sun exposure, day sleep, excessive physical exertion, etc. Samsargaj hetu. Communicable or infectious diseases. Manasik hetu. Excessive worry, antisocial activities. Kulaj hetu. Adibala pravritta vyadhi, that is hereditary disorders. Samprapti ghatak. First one is dosha. Both Vata and Kapha. Dusha. Dusha involvement is of Rasa, Rakta, Mans and Lasika. Strotas. Rasavaha, Raktavaha and Manso Strotas are involved. Strotodushti. Sanchay and Vruddhi can be seen. Udbhavsthan, Amashay and Pakvashay are the Udbhavsthan. Samprapti. When there is Nidan Sevan, three dosh prakop occurs. Those three doshas, after three dosh prakop, Dusha Dushti can occur. And there is involvement of Tvaka, Rakta, Mansa and Lasika. Then Dosha Dusha Samorchana occurs. Then there is a Stroto Dushti. After that, Lakshana Utpatti can be seen and Kushta occurs. Diagnosis. First one is Darshan Parikshan. Biopsy, blood test, X-rays, etc. Sadhya Sadhyata. Asadhya. The Kushta who exhibits all three vitiated doshas in the patches of Kushta. Asadhya. Treatment. Ayurvedic principle of management of psoriasis are Nidan Parivarjana, Shodhana, Shamana, Pathyapathya. Nidan Parivarjan. Nidan Parivarjan means avoiding it like Viruddhahar. Nidan Parivarjana prevents the growth of disease by preventing dosha vitiation. Second one is Shodhan Chikitsa. Shodhan Chikitsa is important in Ekakushta as reoccurrence may occur. This disease is Vata Kapha predominant and Tvaka, Rakta, Mansa, Lasika, Kled all are involved. Elimination of aggravated doshas can be done by Shodhan Chikitsa. These are the methods which are used for Shodhan. First one is when Kapha dosha is dominant, Vaman means emesis karma should be done. When Pitta is dominant, both Virechana means purgation and Rakta Mokshan means bloodletting can be done. When Vata is prevalent, Grita should be recommended. Shaman Chikitsa. Shaman Chikitsa is done by medication to cure different types of Kushta. The medication can be administered with internally or externally. The drugs used in Shaman Chikitsa should be Vata Pitta Shamak, Rakta Prasadak, Vishagna, Kandugna, Kushtagna and Varnya. These are Churna used are Mustadi Churna, Trifaladi Churna, Kashayar, Patol Muladi Kashaya, Amrutadi Kashaya, Asavas, Madhvasa, Trifalasa, and in Gruta, we can use Mahatikta Gruta, Tikta Gruta, Panchatikta Gruta, Gugul Tikta Gruta, yoga or meditation. When stress is major factor, we can recommend yoga or meditation. Ahar, one should avoid oily spicy food or non-veg. Vihar, day sleep, veg dharan, atap sevan should be avoided. Discussion. Skin disorder is burning cosmetic issue nowadays. and it results in losing of beauty. In Ayurveda, all skin disorders are explained under Kushta and psoriasis is explained under Ekakushta. Etiological factors like consumption of viruddhahar, day sleep, vata pitta prakopak ahar and vihar. Nowadays, people are knowingly or unknowingly habitual for such dietary combinations or lifestyle. Also, there is no as such permanent line of treatment in modern medicine without any adverse effect. So, there is need to develop Ayurvedic management for psoriasis. Conclusion: psoriasis is non-infectious inflammatory skin disorder. It affects both sex and all age groups. According to Ayurveda, Kushta is most chronic disorder. All dermatological problems with their classification, etiopathogenesis, clinical presentation, prevention and management is explained under Kushta. There is need to make people aware about their wrong habits as Nidan Parivarjana is the first line of treatment. Thank you.
Thank you, doctor. Next, I invite Dr. Jayanti Nayak for presenting the paper on the topic allergic bronchopulmonary aspergillosis and role of Guduchi. I invite Dr. Jayanti Nayak.
Good evening, doctors. Am I audible?
Audible, doctor.
Is my screen is visible?
Screen is visible, doctor.
Yes, doctor.
Okay. Okay. Good evening, doctors. My name is Dr. Jayati Nayak. I'm final year MD Agatantra student from Sumati Bai Shah Ayurved Mahavidyalaya, Pune, Maharashtra. Today's my topic is allergic bronchopulmonary aspergillosis and role of Guduchi. Introduction. Allergic bronchopulmonary aspergillosis is a condition characterized by an aggregated response of the immune system, that is a hypersensitivity response, to the fungus Aspergillus, most commonly Aspergillus fumigatus. This is a condition where a patient develops an allergy to the spores of Aspergillus molds. Predominantly, it affects asthma patients, but also cystic fibrosis and bronchiectasis patients are also get affected by this fungus. Allergic bronchopulmonary aspergillosis or ABPA is a condition for which there is as yet no complete cure. So it is managed using steroids and antifungals in order to avoid any lung damage. The fungus takes up residence in the lungs and grows in the air spaces deep within. The fungus does not invade the lung tissue itself because it is a non-invasive type, but sets up a permanent source for irritation and allergic reaction. Sufferers of ABPA find anywhere that has increased level of airborne molds, spores, can trigger severe asthmatic reaction. For example, composed hips, damp buildings, and even the outside air in some places at particular times of the year. Avoiding overexposure, staying indoors, or using a protective face mask may be advisable to minimize exacerbation of symptoms. Now, the common signs and symptoms of ABPA. The first one is coughing with mucus plug that is brown in color, wheezing, difficulty exercising, chest pain or tightness, and recurrent fever. The classification of ABPA, there are 4 types of ABPA. The first one is ABPA-S, that is all the diagnostic features of ABPA included. The second one is ABPA-B, that is ABPA with the bronchiectasis found on the CT of the chest. ABPA-HAM is the third type, that is ABPA with high attenuation mucus. And the fourth one is ABPA-CPF, that is with chronic pleuropulmonary fiber. Objective diagnosis. Examination of a sputum sample, chest X-ray, CT scan, and blood test. ABPA is considered in Ayurvedic view, ABPA is considered as Mahashwas, which is mainly triggered due to Vata and Kapha dosh and causes breathlessness, coughing, and wheezing. If remain untreated, may cause bronchiectasis and also spread throughout the body, affect only body organs such as brain and liver. Ayurveda provides effective herbal drugs to treat ABPA. Now the role of Guduchi. Guduchi is one of the frequently used drugs to treat the Madhumeha, Pandu, Kamla, Amlapitta, Grahani, Kushtha, Jeerna Jwar evam Visham Jwara, Trishna, Shul, and Yakrat Vikar, etc. It's a use since Vedic period, and it is the best choice in terms of effectiveness, ease of availability, economy, and administration. It is already mentioned in the Samhitas, Nighantus, and Granthas for its effectiveness. Chemical composition. The botanical name of Guduchi is Tinospora cordifolia, and there are so many types of chemicals present in the Guduchi, and named are alkaloids, glycosides, diterpenoid lactones, steroids, and aliphatic compounds. The nutritional value of Guduchi is the fiber content is 15.9%, proteins is 4.5% to 11.2%, sufficient carbohydrate that is 61.66%, low fat that is 3.1%. It has 292.54 calories per 100 grams. It has high potassium that is 0.845%, high chromium that is 0.006%, sufficient iron around 0.28%, and sufficient calcium that is 0.131%. The pharmacological activities of Guduchis are, it is anti-diabetic, anti-pyretic, anti-spasmodic, anti-inflammatory, anti-neoplastic activities, antioxidant, immunomodulator, anti-stress, anti-leprotic, anti-malarial, hepatoprotective, anti-allergic, anti-arthritic, and antifungal. The effectiveness of Guduchi, the aqueous extract of Guduchi stem is more effective on Aspergillus fumigatus and less effective on Aspergillus niger. The ethanolic extract, methanolic extract, and acetone extract of stems are also effective on Aspergillus fumigatus. Thank you.
Thank you, Doctor. Next, I invite Dr. Pradanya Balakrishna for the presentation. I invite Dr. Pradanya Balakrishna for the paper and poster presentation.
Hello, everyone. 1 minute, madam. I'm sharing screen. Madam. Hello, ma'am.
Hello, doctor.
There is problem in sharing this PPT.
Okay, doctor. Please try again. You can present next.
Okay, ma'am.
Now I invite Dr. Sagar Hemant Bankar for presenting the paper on the topic Shila Jadu, Rasayana and Vajikarana. I invite Dr. Sagar Hemant for the presentation.
Good evening, everyone. Am I audible?
Yes, doctor.
Good evening, everyone. I am Dr. Sagar Bangar, final MD final student. I am from College of Ayurveda and Research Center, Nigdi, Pune. So my topic for the presentation is Shila Jatu as a Rasayana and Vajikaran. Ancient scientists of Ayurveda had developed certain therapeutic measures to rejuvenate functional dynamics of the body and also to improve aphrodisiac activity, which comes under Rasayana and Vajikarana respectively. One of the drugs named Shilajatu possesses both these properties, which defines its distinct nature. Shilajatu is a pale brown to blackish brown exuding from layers of rock, which consist a complex mixture of organic humic substances and plant and microbial metabolites. It has been used as a rejuvenator and as an aphrodisiac for thousands of years in one or the other form. After different ancient pharmaceutical treatment, Shodhita, Shilajatu can cure many asadhya yapya diseases. In present time, considering the potential medicinal effects of Shilajatu, many research works are being carried on to explore its scientific explanation. Present article is an endeavor to review the studies done on Shilajatu as Rasayana as well as Vajikaran. So the aim is to compile the studies of Shilajatu for its Rasayana and Vajikaran properties. The materials and methods used are the Bruhatrayas of Ayurveda was scrutinized and reviewed for its types like Charak Samhita, Sushrut Samhita, Ashtanga Hridaya, and other research journals. So the observations that were made were Charak Samhita has mentioned 4 types of Shilajatu: Swarna, Raja, Tamra, and Loha. Out of these 4 varieties, Loha variety is mentioned as the best. Sushrut Samhita narrated 6 varieties of Shilajatu by adding Vanga and Naga to former 4 types mentioned in Charak Samhita. So Shilajatu as a Rasayan. Ayurveda describes many diseases which incorporate HIV-like illnesses. Example: Rajakshama, Ojokshay, Sannipat, Jwara, etc. HIV infection affects multi-systems, chiefly the immune system, which can be correlated to Ojokshay. Rasayana Chikitsa is the frontline therapy employed to treat Oj disorders. Therefore, Shilajatu, Mandukparni, Amalki are well known for their immunomodulator and antioxidant properties. Were selected to evaluate their role on immune system. The case was carried on 20 patients from OPD and IPD of Kai Chikitsa SS Hospital, IMS BHU, and was randomly allocated into treated groups and control group. The treated group controlled of Shilajatu plus ART and the control group consisted only of ART. The treated group responded better to ART both clinically and biochemically. The result shows that Shilajatu decreases the recurrent resistance of HIV virus to ART and improves the outcome of the therapies done. Ayurveda has a wide range of herbs and minerals to strengthen the ovarian functions. The goal is to reduce the circulating androgens, optimize ovarian functions, and support optimal endocrine function. Research study conducted at AVS Bijapur shows its efficacy as an antioxidant, immunomodulatory, hypoglycemic, and hypolipidemic agent. And Shilajatu Rasayan is expected to contribute positive and better result in PCOS. Hence, the study was undertaken to assess its effect on ovarian volume, reduction of cysts hormone, and induction of ovulation in letrozole-induced PCOS. These findings are consistent with the therapeutic use of Shilajatu as an Ayurvedic Rasayana against oxidative stress and geriatric complaints. Shilajatu significantly lowers the levels of 5-HT and 5-HIIA and increases the level of DA and Na and their metabolites. In a rat brain, the finding is appraised in view of its use as an Ayurvedic Rasayana. Discussion. So the Rasayana and Vajikaran are 2 backbones of Ayurvedic treatments. Each and every treatment is incomplete without these two. To acquire both of these gold, the gold standard drug is Shila Jatu, as it has both of the properties. As per studies mentioned in this paper, Shila Jatu is the gold and standard option when the requirement of treatment is of Rasayan and Vajikara. These are the references used further used in the article. Thank you.
Thank you, doctor.
Doctor? Hello, Dr. Aishwarya. Are you there?
Yes, Dr. Sabin. Hello, Dr. Sabin.
Yes, doctor. Your voice is clear, doctor.
Okay. Doctor, can you please share the PPT
1 minute, doctor.
for Dr. Pradanya?
1 minute, 1 minute.
Madam.
Doctor, screen is visible?
Yes, sir.
Okay, please
Thank you,
continue.
sir. I'm audible?
Audible, doctor, audible.
Okay. Myself, Dr. Pradnya Balakrishna Wankade, PG scholar from Shri Ayurved Mahavidyalaya, Nagpur. I am presenting the topic importance of Kal in Sanshodhana, that is detoxification of body, a review under the guidance of HOD Professor Dr. Brijesh Mishra and guide Associate Professor Dr. Harish Purohit sir. Next slide. Introduction. Kalo hi Nama Bhagwan. Kal is the name of divinity which is self-form, has no beginning or middle or end. Abnormalities and excellence of states and life and death of human being are dependent on it. It does not spare even minute things that is without causing change, makes all things into one group, and it brings about death, that is destruction of all living beings. We call time is actually parinam, that is changes taking place constantly, makes all living things to form one group because of its nature of destroying all. It influences living beings with happiness and misery. It shortens life. It takes living beings near to death. Kal means count, and all the factors and activities in body as well as in environment are under control of it. Next. In case of disease, about this topic, first step of treatment is Nidan Parivarjan as preventive measure, and second one is Samprapti Vikatan, which is of two types. First is Shaman and second is Shodhan. Sanshodhana is unique concept of Ayurveda, that is by this detoxification of body is done. In treatment principle, Kal is important factor to decide suitable therapy for good results. If Sanshodhana, that is elimination therapy, is not done at proper time, it causes complications. In case of emergencies, maintaining suitable environment is to be made. Thus, Kal plays a vital role in Sanshodhana. My topic's aim is to discuss and elaborate importance and relation of Kal in Sanshodhana. Objective is to study the Kal division, that is Rutu for elimination therapy, to study the dosha, shaya, prakop, etc. according to Rutu considering Sanshodhana. Next. Material and methods. This paper is based on textual review Literary data is related to Sanshodhan Kal was collected from Charak Samhita, Shushruta Samhita, Ashtang Hruday, Ashtang Shangra along with commentaries of them. To collect information on the relevant topic, related articles are were referred. Next, reference form Charak Vimansthan, that is Kal or time denotes two meanings, the year and the state of the disease. The present division is in keeping with administration of elimination therapy, that is Hemant, winter, Grishma and Varsha. These are the three seasons characterized by cold weather, hot weather and rains. And other three seasons are Pravrut, Sharad and Vasanta, which are of moderate nature. Pravrut season characterized by beginning of rain and then follows the rainy season. Ashad and Shravan, these months constitute Pravrut season. In their order, other seasons are also composed of 2 months of each. Shishir season does not find place in this classification. Instead, there is an addition of Pravrut season before Varsha season. Suitable seasons for elimination therapy. Elimination therapies like Vaman, etc. should be administered only in seasons of moderate nature. In other seasons having extreme cold, heat and rain, such therapies should not be administered. Moderate seasons characterized by moderation in cold, heat and rain. They are very pleasant and they do not adversely affect the condition of the body and drugs. Remaining seasons are characterized by extreme cold, heat and rain. They are very unpleasant and the body as well as medicines are adversely affected by them. Unsuitable seasons for elimination therapy. Seasons that is Hemant, body is exposed to excessive cold, dosha adhere to body, and medicaments of elimination therapy are hot by nature. That is, therapeutic effect of these drugs are diminished in Hemant. Effect on patient due to less potent drugs, desired effect not produced and complication occurs. In Grishma, body is exposed of doshas and complication occurs in patients. In Varsha Ritu, body is exposure to rain, water, and body becomes more delicquescent. Medicaments are not well good. Impairment of medicaments occurs in this Varsha Ritu. And effect on patient is improper manifestation of urges of emesis and take long time for recovery. Therefore, suitable seasons are selected for administration therapy of Sanshodhana and for mixed with cow's urine, which latter is hot in potency, and this therapy should be given in larger dose. The dose of therapy should be so adjusted as would not prove fatal to the patient. In emergencies, natural manifestation of seasons, that is excessive cold, heat and rain, should be counteracted by artificial means, such as in summer seasons. Summer should be counteracted by creating cooling environment, and these elimination therapies can be administered. Next. Reference from Charak Siddhisthan. Grishma, Varsha and Hemant are characterized by excessive heat, rain and cold. The three are intervening seasons are general nature. Above mentioned three seasons are suitable for administration of elimination therapies. After determining the exact month constituting the mentioned season, the physician should give appropriate elimination therapies to healthy person. However, for a patient, appropriateness of the time should be determined on the basis of nature of the disease. Ashtang Hridaya, Vata and other two doshas which are undergone Chaya in Grishma, Varsha and Hemant should be removed out in the 3 Sadharan months, that is Shravan, Kartik and Chaitra respectively. Grishma, Varsha and Hemant have too much heat, rain and cold respectively in the period in between these, known as Sadharan Kala. Sadharan Kala are the seasons which has neither too much or nor too less heat, cold and rain. In these seasons, the doshas should be cleared out. After having overcome on the effects of cold, hot and rainy seasons suitably, necessary treatment should be administered. The Kriya Kal, the period of abnormal activity, stage of disease evolution should not be allowed to progress. Ashtang Sangraha, elimination of doshas accumulated due to the cold season is to be done during Vasant Rutu, that of the Grishma during rainy season, that of the Varsha Rutu during Sharad. This makes the person get rid of the disease caused by the effect of season. This suggested to avoid bad effects of the doshas which undergo abnormality due to the effect of season. The doshas which have increased in particular Rutu will have to be mitigated in succeeding Rutus. In Sushru Samhita, in this sign, Varsha, Sharad, Hemant, Vasant, Grishma and Praun are the 6 seasons which are the causes of the Upachaya, Prakop and Upashama of the doshas. Doshas which have undergone mild increase in Varsha, Hemant, Grishma should be eliminated out during Sharad, Vasanta, Pragut, when these will be have undergone great increase respectively. Disease produced by Pitta subside during Hemant. Those produced by Kapha subside during Nidak, that is Grishma, and those produced by Vat subside during Sharada. This is natural only. Thus, we were described the mild increase, great increase, and mitigation of the doshas. The aggravated Shleshma should be eliminated out during Vasanta, Pitta during Sharada, and Vata during Varsha season before this produce disease. Discussion. Hemant, Grishma are the 3 seasons ending with rainy season. Elimination therapy like emesis should not be administered unless there is an emergency. In such emergencies, natural manifestation of seasons like heat of the summer should be counteracted by creating cooling environment, and these elimination therapy can be administered. The physician is advised not to ignore such urgent needs for the administration of elimination therapies. Similarly, suitable changes should be brought about in medicaments. Final conclusion is Sanshodhana, that is detoxification of doshas from body, is unique concept of Ayurveda. It acts in 2 ways: prevention of disease and cure of disease. In case of Shodhana, Kali is to be considered firstly. Shodhan done at proper time gives fruitful results. If done at improper time, it causes complications, even death, just like trees get distracted by heavy rain. So, for successful treatment in Sanshodhana, Kal is prime factor. Thank you. These are the references, and thank you.
Thank you, Doctor.
No.
One more post presentation is pending. I will share the screen for you.
I'm prepared. Please present my poster, sir.
1 minute, Doctor. The topic of poster presentation is division of Kal according to Samshodhana, purification of body.
Okay, sir. Okay.
Please continue, Doctor.
Introduction. My
Please
topic
continue.
is firstly division of Kal according to Sanshodhana. Introduction. Division of Kal for Sanshodhana is different than division of Kal according to Rasa and Bala. Here, Shishir season does not find a place in this classification. Instead of that, there is an addition of Pravrut season before Varsha, that is rainy season. Hemant, Grishma, and Varsha, these are the seasons. These are three seasons characterized by cold weather, hot weather, and rain. Pravrut, Sharad, and Vasant are of moderate nature. Pravrut season is characterized by the beginning of rain and follows by rainy season. Division of the year into 6 seasons for describing the manifestation of various rasas and tastes is different from what is described in this poster presentation. The present division is in keeping with the administration of elimination therapy. We know in Vasant Rutu there is Kapha Prakopa. In this season we select the process of emesis, that is Vaman. In Sharad Rutu there is Pitta Prakopa and we select the process of Virechana as a treatment. In Pravrut Rutu, Vata Prakopa is there, so we select the treatment as a Sanshodhan, that is Basti. These are the references from Sushru Sutrasthan, chapter 6, Doshchay, Prokop and Prashama. That is a natural mitigation of doshas. Vata Sanchay in Grishma, Vata Prokop in Varsha, and Vata Prasham in Sharada. Pitta Sanchay in Varsha, Pitta Prokop in Sharada, Pitta Prasham in Hemanta. Kapha Sanchay in Shishira, Kapha Prokop in Vasanta, and Kapha Prashaman in Grishma. And second one is according to Sanshodhan Kal, that is Dosha Sanchay in Varsha, Pitta Dosh Sanchay in Varsha, Pitta Dosh Prokop in Sharada, and Pitta Sanshodhan Kal is Sharad Rutu. Pitta Sanchay in Hemanta, Kapha Sanchay in Hemanta, Kapha Prokop in Vasanta, and Kapha Sanshodhan Kal is Vasanta. That is Prokop Kal is a Sanshodhan Kal. Vata Sanchay in Grishma, Vata Prokop in Pravrut Rutu, and Vata Sanshodhan Kal is Pravrut Rutu. The division of Rutuds, that is seasons, according to Charak Vimansthan, chapter number 8. Marathi Rutus are there. Pravrut Rutu, Marathi Rutu, and Marathi month is Ashad Shravan. Months according to Greek is July, August, June, July, and July, August. Varsha Rutu, that is Bhadrapad and Ashwin, August, September, that is September and September, October. Sharad Rutu, Kartik, Margashish, October, November, and November, December. Hemant Rutu, Paush, Magh, December, January, and January, Feb. Vasant Rutu, Falgun and Chaitra, Feb, March, and March, April. Grishma Rutu, Vaishakh and Jeshta, April, May, and May, June. These are the classification or division of Kal according to Sanshodhana. Discussion. Sanshodhana should be done at proper timing to avoid disease condition as well as Upadrava occurs. Conclusion is, in case of Sanshodhana, Kal is to be considered firstly for good results. Thank you, sir.
Thank you, Doctor.
Thank you, Doctor. Next, I invite Dr. Ankita Danyeshwar for the paper presentation.
Hello.
Hello.
Is my screen, is my audio is audible?
Audible,
Am I
Doctor.
audible?
You are audible. Your screen is not visible.
I'm sharing my screen. Now?
It's sharing.
No.
Doctor, your screen is not visible. It's in sharing mode. I think you have some network issues.
Some time.
Okay, Doctor. Okay, sure, Doctor.
Okay.
Okay, Doctor. Now your screen is visible, Doctor.
Okay, sir. Good evening. Good evening, all dignities and all participants. Myself, Dr. Ankita Ahmed. I'm a PG scholar of Rachanacharya Department from Sumatibai Shah Vidyalay, Pune. And my guide and HOD of our department, respected Dr. Girish Kulkarni sir. And today, my topic of paper presentation is Association of Rasavas Drushti and its effect on Garbhini and Garbha in literature review. I have chosen this topic because we all know prevalence of the birth defect in lactation insufficiency and stress are increasing day by day. So what are the hetus, root cause behind this? According to Bruhitri, I have to focus on that. यावन्ते पुरुषः उत्पन्तो भावविशेषास्तावत् एव अस्मिन् कारविशेषः सर्वे हि भावाः पुरुषे अन्तरेण स्रोतस्य अभिनिवर्तन्ते क्षयं वा अपि अभिगच्छन्ति.
Hello, doctor.
Hello, Dr. Ankita.
Ma'am, my screen is visible.
No, doctor.
No, doctor. Your screen is not visible, doctor.
Right now,
No, doctor.
please give me your time. Network issue.
Okay, doctor.
One. Hello.
Hello, doctor.
Doctor.
Presentation one participant after.
Your screen is not visible,
I
doctor.
will. But can I take some time and
Sure,
can take
doctor.
one
Sure.
participant?
Sure,
Thank
doctor. You can present one after next. Okay.
Okay, doctor. So next I invite Dr. Nikita Bharat Lolage for presenting the paper.
Hello.
Hello, doctor.
Yes, good evening, sir. I'm sharing my screen.
Okay, doctor.
So is it sharing? Hello.
Hello, doctor. Your screen is visible, doctor. Please start the session.
Okay. Management of Jeerna Pratishay, a case study. Myself, Vaidya Nikita Lolge, MD Panchakarma, final year, CRC Pune, and my guide is Vaidya Varsha Sane, HOD of Department of Panchakarma, CRC Pune. Introduction. Due to development of science, the increase in urbanization is leading to pollution and causing infectious diseases. The most common upsurge of diseases is Jeerna Pratishay. Repeated attack, improper management or negligence of the acute stage leads to disease to chronic stage. Case report. A 27 years old male IT professional came to the OPD with following complaints: nasal discharge, nasal blockage at night, sneezing, which was severe at night and morning time, nasal itching. He has these complaints continuous for 6 months. History, tonsillectomy 10 years back. His job was in AC for 10 years, 10 hours per day, no exercise, irregular diet timings, and fast food. Examinations. Nose, inflammation of nasal mucosa. Prakruti, Pitta Pradhana Kapha. BP 124 by 82 mm of Hg. Pulse 78 per minute. Weight 75.5 kg. Abdominal palpation, it was non-tender. He didn't get any other investigations done before, nor took any medications before. Treatment details. Patient was treated on OPD basis following the 1-month treatment plan. Pathya Apatya, patient was advised to change his lifestyle and diet. Internal medications for first 7 days. Vaishvanar Churna, 500 mg BD. Sitopaladi Churna, 500 mg BD plus honey BD. Chitrak Haritiki Avaleha, 1 tablespoon BD. Gandharva Haritiki Churna, 500 mg HS with warm water. Classical Nasya with Anutel, 6 drops at 10 a.m. for 7 days. Along with Sarvanga Snehan with Tilatel and Sarvanga Swedan, which was Bashpa Swed. For next 15 days, Vardhaman Pipali Rasayan was given 1 to 5 grams twice per day for first 5 days. Then 5 grams twice per day for next 5 days, and 5 to 1 gram twice per day for next 5 days. Like this, 15 days it was given. Observation and results. After first follow-up, patient felt up to 70% relief in all his complaints. After second follow-up, he had relief up to 100% with no recurrence of any symptoms. Discussion. In Ayurveda, Panchakarma has prime important role in the treatment of diseases. Deepan Pachan, Vaishvanar Churna causes Pachan and of Ama and Vatanuloman of doshas. Chitrak Haritaki Avaleha causes Pachan of Kapha and Vatanuloman and has Vatanuloman property. Gandharva Haritaki Churna causes Vatanuloman. Anutailanasya removes the local vitiated doshas from Shira Pradesh through nose, which helps to break the samprapti of pratishyaya. Significance of Nasya and its mode of action. In the disease of head and supraclavicular diseases, Nasya is the most effective procedure. Nasahi Shiraso Dwaram, that means nasal passage is the getaway of head, and the drugs given through the nasal passage mitigate the various vitiated doshas and and cure the diseases. So mode of action, a local effect is irritating drugs, then stimulation of olfactory neurons, sneeze reflux, and expulsion of secretion from the nasal sinus. Systematic effect, absorption of nasal drops, a stimulation of hypothalamus, release of certain neurochemical transmitters, and decrease in the symptoms of disease. Pipali Rasayan, it is specifically indicated in Pratishyaya treatment in Samhita, which helps to prevent the recurrence of symptoms. Conclusion, it can be thus concluded that Jirna Pratishyaya can be a fast and effective treatment, can be effectively treated by Anutailanasya and Pipali Rasayan along with Deepan Pachan treatment. These are the references that I've used. Thank you.
Thank you, doctor.
Thank you, doctor.
Okay.
Next, I invite Dr. Meenakshi for presenting the paper on the topic review of Kandakarya Avaleha with respect to Pranavaha Srotas.
Yes, ma'am. Am I audible, ma'am?
Yes, doctor, audible.
Just a second, sir.
Yes, doctor.
Okay, doctor.
कोणतं आहे? ओपन करून ठेवलेस का? ओपन कुठे ठेवलाय तू करून? हे कर मिनिमाइज कर. कुठे ओपन करू? ओपन नाही होत. अजून दुसरीकडे आहे का? आयकॉन करून ओपन कर. Second, sir.
Hello, Dr. Meenakshi. Please start the session.
Just a second, ma'am. Ma'am, is my screen visible?
No, doctor, not visible, doctor.
No, doctor. It's not visible, doctor.
Yes, doctor. Now your screen is visible, doctor.
Okay, sir. Good evening, everyone. Hello, sir. Good evening, everyone, and all participants. Myself, Vaidya Meenakshi Munzaji Nasai. I'm a PG scholar of Rasashastra and Bhashya Kalpana Department of SSAM Hadapsar, Pune. My guide is respected Dr. Pallavi Bhange ma'am. Today I am presenting the review of Kantakari Avleha with special reference to Pranava Srotas. Rasashastra and Bhashyachi Kalpana is the main subject which describes the preparation methods, dosage, usage of different Ayurvedic formulations of herbal, mineral, and metallic drugs. Kantakari Avleya is the semi-solid dosage form having long shelf life in comparison to primary dosage forms and can be administered to all the three age groups, that is Bala, Yuva, and Vruddha. Kantakari Avleya is one of multi-drug combination which encompasses and subdues all the different Samprapti Ghatakas and thus give relief to the Kasa, Shwasa, and Hikka Vyadhi according to well-known statement of Samprapti Vigatana Chikitsa. The basic material required for this dosage form includes the Drava Dravya, that is liquid substances, Madhura Dravya, Prakshepa Dravya, and Kalka Dravya. Diseases like the Kasa, Shwasa, Hikka, that is Pranava Sotas Vyadis, have been treated with different avalehas. Large number of avaleha have been described for the treatment of Shwasa Roga, as these have Grihan property, which is very much needed while dealing with this disease. According to Acharya Sushruta, when natural movement of the pranavayu is hampered and it is associated with kapha, then it leads to the origin of Shwasa Roga in the upward movement of Vata is enhanced. Material and method. These causes of petition are mentioned in the Charak Vimanstan, 5th chapter. These causes are Kshaya, that is depletion of tissue, Sandharan, that is possibly withholding the natural body reflexes or the urges. Those are the stool and urine. Rokshata, that is intake of a dry food. Vyamata Kshuditasya, that is excessive exercise in presence of the hunger. Anya Daruna Karya, that is doing many such activities which are beyond the one's physical capacity. Pranavastrota Dushti Lakshanas. Ati Srushta Shwasa, that is too long, that is prolonged breathing. Ati Baddham, too short breathing. Kupitam Shwasa, that is difficulty breathing. Alpam Shwasa, that is frequent and the interrupted or intermittent breathing. Abhikshnam Shwasam, that is highly disturbed breathing pattern, looking scary. Sa Shabda Shwas, that is abnormal sound during the breathing. Sa Shula Shwas, that is painful breathing. Mulastana Pranavasrotasa, according to Acharya Charak, that is Hriday and Mahasrotasa, and according to Sushru, these are Hriday and Rasavayini Dhamni. In Pranavasrotas Vyadis, Vataj cast is the cast with dry cough, dryness in the mouth and throat, excluding pain in the epigastric region, flank, chest, and head. Bronchial asthma, that stomach shwas, is a chronic inflammatory disorder of the airway that causes the recurrent episodes of breathlessness. The increasing global prevalence of respiratory disorders, the high healthcare costs have led to extensive research in its mechanism and treatment. Kantakari Avleha is an important polyherbal formulation mentioned in the Ayurvedic Pharmacopoeia of India, Part 1. The pathogenesis, that is Samprapti, is explained in the following manner in Ayurvedic text. Samprapti of Shwasa, that is Nidana, Hetu 7, then Vata Kapha Dushti, Kapha Kapha Udirna, Srotorod by Kapha, then Avarana of Vata, that is respiratory airway block. Pratilom Gati of Vata, then entry into the Kapha Sthana, Vata entering into the site of Kapha, then Samudra of, that is deviation of Kapha, then it causes a Shwas. As like Shwasa, there is also Samprapti of Kas, that is Adha Pratihito Vayu, Urdhva Strota Samashrita, Udana Bhava Apana Kante Sapta Thorasi, Avishyaha Stirasi Khani, Sarvani Puti Pratipurayana. This produces breaking pain and jerking in the whole body, particularly causing strain and stiffness in the Hanu, Manya, Akshi, Prushta, and Ura Parshva. Thus, kapha arises. As like a Shwasa, Kasa, Hikka is also produces by the Prokop of Kapha in the Amashaya, then Vimarga Gaman of Kapha, the Pranava Sprota Dushti, that is obstruction in the direction of the Pranavayu, destruction of Prana and Udanavayu, the direction, disturb the normal way of the Shwasa, that is normal laya of Shwasa, and it produces Hikka. Ingredients of Kantakari Avaleha as Kantakari, Jala, Sita, Grita, Taila Madhu. Kantakari is quantity is 1 tula, Jala is a 1 drone, Sita is a 20 pul, Grita is a Grita, Taila Madhu are 8 pul. The Praksheva Dravyas are Tugakshiri and Pipali are 4 pul each. Then Guduchi, Chavya Chitrak, Musta, Karkati Shungi, Triushana, Dravya, Bharangi, Rasna, Shati, each are 1 pul. These are the ingredients of Kantakari Avaleha. Method of preparation of Kantakari Avaleha, that heating the Kantakari by Jala, it requires to remain 1/4. It then form its patha. Then Kantakari patha added the Guduchi, Chavya, Chitraka, Musta, Karkat Shungi, Triushana, Dhanvayasa, Bharangi, Rasna, Shati, Charkara, Grita, Taila, and then by heated with the Agni, it forms paka. After cooling of this paka, add honey in this, and after cooling, Prakshebhadravyas, that is Tugakshiri and Pipali also added. The Kantakari is a Katutikta Rasatmaka, Katu Vipaki, Ushnavirya, Lagu Rukshasara Gunatmak, and a Kapavata, its Doshagnata is a Kapavatagna. Solalam Xanthocarpum is it's a botanical name, and Dipan Pachan Karmas. Guduchi, almost all dravyas, that is Guduchi, Chavya, Chitrak, Musta, all are Katutikta Rasatmak, and Vipak, Madhur, all are Katu Vipaki except the Guduchi and Dhanvayas. These are the Madhur Vipaki. Remaining all drugs are Ushna Viryatmak except the Musta and Dhanvayas. These are the Shita Viryatmak. Then Laghu and Ruksha Gun is common in almost all drugs. Doshagnata is Tridoshagna, mostly Kapha and Vatagna. Guduchi, Tenospora cordifelia, its karma is Rasayan, Grahi, Balya, Agni Deepan, Pachan. Chavya is Piper, Retrofractum, Deepan, Pachan, Yakrut Uttejak, Vatanuloman, Krimigna. Chitrak is Plumbago Zalenica, Deepan, Pachan, Grahi. Musta is Cyprus, Rotundus, Deepan, Pachan, Grahi. Karkat Shungi is Pistachia integrima, Deepan, Pachan, Vatanuloman. Triushana, that is Sunta Maricha Pipali, that is Gingiber officinalis, Piper nigrum, and Piper longum. This karmas are Deepan Pachan. Dhanvayas is a Phagonia arabica. Its karmas are Kapha-pittagna. Bharangi is Clerodendron serratum. Deepan Pachan, Rucha. Rasna is a Glucia lanceolata. Its karma is a Pachan, and Prabhav is Vishagna. And Shati is a Hericium, Psychatium, Deepan, and Rucha. Almost all drugs included in a Kantakari Avaleha has a Katu Tikta Kashayras, Katu Vipaka, Ushna Virya, Laghu Ruksha, and Tikshna Guna. Almost all drugs are Tridoshagna, mainly Kapha and Vatagna. Adhikar on his Mahasrotasa, Karma, Deepan, Pachan, Grahi, Balya, Vishagna, and Krimigna. Vyadhi Haradve, Swaskas, and Hikka. Here the few researchers are I review for this study. The study of efficacy of Dushparnadi Leha and the Kantakari Avleha in the management of Vatachkas, critical review of herbs acting on Pranava Srotos Vikar, pharmaceutical and pharmacological evaluation of the Kantakari Avleha. Mode of action, Pranava Srotovikar mainly involves Tridosha, especially Kapha and Vata. Kantakari Avleha has a capability to regulate the three doshas, so it can consider as an ideal drug for the respiratory disorders. Kantakari Avleha having Katu, Tikta, Kashayras, Ushna Virya, Katu Vipaka, and Kapha Vatagna properties seems to quite the naturally antagonize the Shvasa Roga, which is Kapha Vata Pradhan disease, and other also like Hikka and Kasa. The pathogenesis of Pranava Srotas Vyadhi starts from the Amashaya. That is, it starts from the Vyadhi starts from the Amodpatti, and Kantakariya Avleya breaks its samprapti by the Deepan Pachan Karma. So it is very effective in Pranava Srotas Vyadhi. Management, the vitiation of Pranava Srotas should be managed on the line of treatment of Hridroga, Kasa, and Shwasa disorders. The effective treatment of these respiratory disorders cannot be unified as the pathology involves multiple varying factors. In the Shwasa Vyadhi, same symptoms are observed as that of Dushti of Pranava Srotas. Thus, the treatment same for the both conditions. Discussion. Acharya Kashyap Kashyap has given importance to the Avleha Kalpana and has described a separate chapter, namely Leha Adhyay in Sushrut Sutrastan. In Sutrastan. It contains Madhura Dravya. Madhura Dravya, here the use of Madhura Dravya is of great importance because it reduces the Tiktakatu Kashaya taste of the drug, ultimately making it more palatable, and it also nourishes all the dhatus along with Oja. Grita exhibits the property of pacify Vata as well as Pitta, and also has the properties like the Agnidipana, Balakara, Vrisha, etc. Kantakari Avleha has a Brihan property which is very essential in the treatment of Pranava Srotas. Prakshepa Dravya serve specific functions, that is, Pippali acts as a bioavailability enhancer and is antibacterial. They also act as a flavoring agent because most of the Prakshep Dravyas have aroma which improves the acceptability of a product. Regarding Avleha, two more points are to be kept in consideration. These are mode of administration, that is liking, and the high percentage of sugar in the medicament. Both these factors facilitate the oral absorption due to its mode of administration, that is liking. It produces soothing effect in the throat, relieving the local irritation. Conclusion. The literature study revealed that Kantakari Avleha is effective against Kasa, Shwasa, and Hikka, which are pradhana vyadhis of Pranava Srotas, an inflammatory condition of the bronchial tubes. Thank you.
Next, I invite Dr. Vrishali Sriram Amte for presenting the paper on the topic Role of Ayurveda in Lifestyle Disorder.
ऐक ना तुम्हाला शेअर मला
Hello.
Yes, doctor, please continue.
Hello everyone, I am Dr. Vishali Amte from SSM Hadapsar, Pune. Today I am presenting on role of Ayurveda in lifestyle disorders. So aim and objective of the study. The aim and objective of this study is to throw light on preventive aspect of Ayurveda in lifestyle disorders. So what are the definition of lifestyle disorder? So basically, these are ailments primarily based on the day-to-day habits of people and are a result of an inappropriate relationship of people with their environment. These lifestyle disorders are the non-communicable diseases, that is NCDs, such as cardiovascular diseases, stroke, diabetes, obesity, metabolic syndrome, chronic obstructive pulmonary disease, and certain types of cancer, which are heavily linked to lifestyle choices. Problem statement. According to WHO, non-communicable diseases kill around 40 million people each year, which are around 70% of all deaths globally. And in India, nearly 5.8 million people, which is according to a WHO report from 2015, die from NCDs like heart and lung diseases, stroke, cancer, diabetes every year. Or in other words, it can be said that 1 in 4 Indians has a risk of dying from an NCD before they reach the age of 70. So what are the main factors for contributing to lifestyle disorders? First, bad food habits, physical inactivity, wrong body posture, disturbed biological clock, and substance abuse, mainly tobacco and alcohol. Importance of Ayurvedic practices and their role in lifestyle disorders. An important way to control NCDs is to focus on reducing the risk factors associated with these diseases. And Ayurveda, with its holistic approach, integrates healthy lifestyle practices such as Dinacharya, Ritucharya, Ratricharya, Ritushodhana, Rasayana, Ahar Niyam.
Dr. Vishali.
Yes, ma'am.
Hello, Dr. Vishali. Your slide is not moving.
Okay. What should I do, ma'am?
Just move slides. It's visible, but still in the first slide.
Okay. Are they moving now?
Yeah, now it's okay. Doctor.
Hello.
Yes, yes.
So Ayurveda, with its holistic approach, helps to curb these diseases by integrating the healthy lifestyle practices such as Dinacharya, Ritucharya, Ratricharya, Ritushodhana, Rasayana, Haraniyam, Achar Rasayan, which promotes correction of bad lifestyle practices. So this in turn reduces the risk factors and thereby preventing the lifestyle disorders. Materials and methods. As this is a conceptual study, so it is based on elaboration and interpretation of references from various classic Ayurvedic texts, along with reference books, research articles, and web sources. Discussion. Ayurvedic lifestyle practices. Ayurvedic practices help in curbing the risk factors for lifestyle disorders, which is by correction of unhealthy eating habits, promoting physical activities, correcting the biological clock, balancing of doshas, rejuvenation of tissues, and promoting moral values and ethical behaviors. The underlying mechanism of these actions, which may be elaborated as onwards. The following of Dinacharya and Ratricharya causes alignment of biological clock, that is circadian rhythm. Disruption of this circadian rhythm is called chrono disruption, which is proved to be a risk factor for many diseases like heart diseases, diabetes, and is proved to be carcinogenic. Dinacharya and Ratricharya Palana curb these risk factors and prevents development of these diseases. And the various procedures in Dinacharya help in maintenance of hygiene and health of various organs. Vyayama and Abhyanga helps in maintenance of overall body health. Reduced physical activity is one of the risk factors for lifestyle disorder, which is kept in check by Vyayama. This balanced circadian rhythm also results in a balanced hormonal cycle. which in turn helps in overall maintenance of health. Ritucharya and Ritushodhana help in balancing of doshas from time to time and thereby keeping the body healthy. Rasayana promotes the rejuvenation of body tissues and in disease state, when given in disease, or if given organ-specific rasayana, they also help in healthy individuals to maintain health. Following of scientific Ahara Niyama help in correcting unhealthy eating practices and in turn help in maintenance of health in a healthy individual and also in management of chronic diseases and keeping at bay lifestyle disorders like obesity, diabetes, and cardiac diseases. Achar Rasayan Palana promotes moral values and ethical practices, which in turn causes healthy intrapersonal and interpersonal relations and in abstinence from substance abuse, which helps in prevention of diseases caused by substance abuse. Summary: Ayurvedic practices help in prevention of disease by promoting healthy lifestyle practices, by correcting circadian rhythm, by maintaining healthy hormonal axis, by balancing of doshas and purification of body, by promoting physical activities, by rejuvenation of body tissues, and by providing sound mind by promoting moral and ethical behaviors. So it can be concluded that Ayurveda plays a preventive as well as palliative role in lifestyle disorders, and there is a lot of potential in Ayurveda to contribute in the care of lifestyle disorders. These are some of the references. Thank you.
Thank you, Doctor. And next I invite Dr. Ankita Dhanveshwar Raimal
Hello, ma'am.
for
I'm
the paper
audible. I'm sharing
presentation.
my screen.
Yes,
Hello.
Doctor, you are audible.
Okay, I'm sharing my screen. Is that visible?
It's sharing now. Yeah, it's visible.
Okay. Again, I introduce myself. Good evening, all dignities and participants. Myself, Dr. Ankita Raimal. I'm a PG scholar from Rajna Shari, Hadapsar, Pune, Sumatibai Shah Hospital. And my guide and HOD is respected Dr. Girish Kulkarni. Today, my topic of paper presentation is Association of Prasava Srotas Drushti and its effect on Garbhini and Garbha. It's a literature review. Why I chose this topic? Because we all know the prevalence of birth defect, infertility, menstrual disorder, lactation insufficiency, stress are increasing day by day. So what are the exact cause? What is the exact hetu behind this? According to Ayurveda, according to Bhutre, I want to focus on it. यावंत पुरुष मूर्ती म्हणतो भाव विशेष सावंत एव अस्मिन् स्रोतसा प्रकार विशेषा सर्वे हि भावा पुरुषे नान्तरेण स्रोतांसि अभिवर्तन्ते क्षयं वा अपि अभिगच्छन्ति. Charak Brahmastan 5/3. The meaning of this is in human body there are so many body elements. Same, there are many strotas also present. Without the strotas, they neither be formed nor be destroyed. Then what is the strotas exactly? Strotas are the channels that make the path for the dhatus. That is, the dhatu is the body element which undergo into metabolic process which help in the circulation. There are many types and numbers of strotas are mentioned in the Bruhatrins. Strotas are having many synonyms like Siraj, Dhamnis, Rasayani, etc. What the strotas having immense importance because of the specific anatomical structure called as the Moolasthana. Normal functioning of the particular strotas is depending on the Moolasthana. If any abnormalities occur with them, the process of formation of dhatus get destroyed. The main three functions of strotas are the stravan, that is the secretion, parinaman, that is production of and recycling, and utsarjana, that is the excretion of the waste product. According to Acharya Charaka, Bahirmukha strotas are 9, Antarmukha is 14. According to Sushruta, 11 pairs of strotas exist, that is 22 strotas totally. Acharya Vagbhata mentioned Bahirmukha strotas 9 and Antarmukhi 14. According to, wait a minute, ma'am. As per Charaka, Garbha Utpattikar Bhava, That is as per Charaka, Garbhotikar Bhava 3/3 in Sharistan, Acharya Charak mention a 6 Garbhotikar Bhava. That is a Matruja, Pitruja, Atmaja, Satmaja. And hence we can see the importance of the Rasadhatu for the Garbhotikar Bhava. And according to, ma'am, wait a minute, there is some issue.
Okay, doctor.
Okay. Ma'am, my screen is visible?
Yes,
Yes,
doctor,
doctor.
visible.
According to Charaka, Moolsthano of the Rasava Srotas is Hridaya and it related 10 dhammis. But according to Sushruta, Hridaya is a Moolsthan, but dhammis are 24. Out of them, 10 going upward, 10 downward, and 4 going slide by obliquely. And it nourishes the entire body constantly. Rasa travels through the body with the help of these dhammis. Rasa Dhatu is a Dravaru, that is a fluid, Somya soft, and Adya Dhatu, that's the first tissue. It nourishes the Uttar Dhatu, that is Rasa Rakta Mansamida, Asti Majja Shukra. Stanya and Raja are the upadhatus of a Rasadhatu. And if vitiation of the Rasadhatu occurs, it comes to disorder like Stanyasha, that is lactation insufficiency, and Rajadushti, menstrual disorder. Acharya Sushruta has mentioned 4 factors required for the conception, called as the Ritu, Kshetra, Bija, and Ambu. And Charaka in Shariristan 3/3 have mentioned the Garbhutpattikar Bhava, that is the Matruj Bhava, Pitruj Bhava, Atmaj, Satmaj, and Rasaj. These from this we can consider or see the what is the importance of the Rasadhatu for a conception, formation of embryo, and its nutrition for the of the fetus. These are many studies conducted on the Garbhini and Garbha, but there is association between the Rasava Srota Dushti is not elaborated yet. The result of the study will help to find out the association of the Rasava Srota Dushti and its effect on the Garbhini and Garbha. This data will definitely helpful in preventable risk factor care, surveillance, and of the Garbhini and Garbha Vapor. For the better future of the women and neonate, and early recognition of the correctable lesion is essential, which is the indications for a systematic approach to the study of the Rasava Srotas Dushti. What is the aim of this study? To find out the association between Rasava Srotas Dushti and its effect on the Garbhini and Garbha. An objective to study the Rasava Srotas as per Bhuvatri, to study the Rasava Srotas Dushti Hetu, and the study Rasava Srotas Dushti and its effect on Garbhini and Garbha. Materials and methods, all the details and information is collected from the Bhuvatri. Literature review has been done for the reference, and also related modern texts and research articles are studied for the utility of the research topic. Like now the description. What is the Rasava Srotas? It is a channel that carries a nutrient body fluid. And Moolsthana, as we know, they are Hridaya and the dhammis. No doubt, Hridaya is essential for transforming the nutritions of the body to tissue. And exactly what happened with this Rasava Srotas? When the digestion start, first Ahar Rasa reaches to the Rasava Srotas and Rasa Dhatavagni proceed, and Ahar Rasa get proceed. The process is divided into 3 parts. That is a stool bhag, which is microscopic in nature. Sushma bhag, that is a microscopic, and a mala bhag has excreted a part. Among them, the stool bhag give nourishment to its very own dhatu, that is the rasa dhatu, and where the Sukshma bhag part nourishes the descent dhatu, which rakta dhatu, and the mala nourishes the mala, that is the kapha in the rasa dhatu. Right now, the main thing is this is what is the hetu of the Rasava Srotas Dushti. That is the Guru Shitam Ati Snigdam Ati Matram Samashrutam Rasavahini Dushyanti Chintanamta Achintanat. Rasavaha Srotas get vitiated in the consequence of eating heavy, that is a Guru Ahara, cold, that is Shita Ahara, and very Anctus, that is a Snigda Ahara, and in moderate quantity, that is a Ati Matra, and worrying overmuch, that is a concern, that is a stress. And in from Ashtanga Hruday 3/44 Sharir Stan, आहारस्य विहारस्य स्या दोष गुणे सम धातु धातुभिः विगुणो Yaksha Srotasamsa Pradushaka. Again, they having the similar views, that is abnormal indulgence in the unsuitable food and the activity, that is ahara viha give rise to the diseases. Sushutstan, in Sushutstan, they are 9/12 Sharistan, Sushut Sharistan. They have not mentioned the hetus behind the Stotas Dushti, but they have said the Vitha Lakshan, that is the injured symptom, manifests the incurable condition. Right now, if Rasava Sutas get dusht, what happen actually in the body, that is a ati pravritti, that excessive secretion, then sanga, complete or partial obstruction, Sira Granthi, new growth inside the strotas, and a Vimargaman, leaving its own path and the entering into another path. These are four Rasava Stroto Dushti Lakshana. According to Shushruta, principal function of the rasa is maintaining the freshening individual, that is a prenan karma. Rasava Stroto Dushti lead to the rasa dhatu dushti, and disease which are caused by this dushti of the rasa are either due to vriddhi or the shay. If Ruddhi of the Shaya of the Rasa Dhatu occurs, then it causes chest pain, palpitation, emptiness and the thirst. And if the excess it produces, then it causes abrasions in the heart and increase the nausea and the salivation. And Dushti Lakshan of the Rasava Strotas, according to Charak Sutra Stan 28/9, they have mentioned disinclination for the food, anorexia, dysgeusia, that is a alteration of the taste, ageusia, that is a loss of taste, nausea, heaviness, lethargy, fever with the body ache, faintness, pallor, obstruction of the channel, impotency, asthenia, that is wasting of the body, loss of gastric fire, premature formation, and wrinkles and graying of the hair. These are the arising from the vikruti of the body nutrient fluid. And Ashtanga Hridaya having the similar view on the Stroto Dushti. Rasava Stroto Dushti according to Sushrut Sutrastan. We know the function of the Rasava Strotas, that is a Prenan, Tushti, and the essential to form the further Uttarotter Dhatus. And Vidya Lakshans are Shosha, Akrosha, Vimana, that is the bending of the body, Mohana, delusion, Brahma, that is loss of consciousness, Vepan, that is a giddiness and tremor, and Maran, that is a death. Right now we are going to see what is the actual the relation between Rasava Strotas Dushti and the Garbha and Garbhini. As we know, in Charak Sharistan, they have mentioned the Garbha Utpadaka Bhav, that is a factor essential for the conception, that is a Matruj Bhav born from the mother, Pitruj Bhav born from the father, Atmaj from spirit, Satmaj from the concordance, and the research born from the nutrition and connecting mind, that is a mana. From that we can see what is the research bhav born for the nutrition. Then from a Charaka Shariristan explain actually in woman's body what happened with the aharas. The aharas after digestion of the food consumed by the mother, it is utilized for the maternal nutrition. Then the stana utpatti, stana pushti, and a garbha utpatti and a garbha poshana. Before the fetal body part is not perceptible, it get nourished by the upasnehan and upasvedanya, that is the absorbing moisture and by the osmosis. According to Shushasthana, factors responsible for the conception, they have compared with the germination process. For germination process, seed, soil, water, and seasons are important. Same, exactly same. For the conception of the embryo, we need a period, that is a Rutu, ovulation period, Kshetra, healthy uterus, and the area, that is for fertilization, that is ampulla, fallopian tube, ambu, that is aharasa, proper nourishment, and union of the sperm and the ovum, that is bija. Here also we can see the ambu, aharas is main factor for the garbha poshan and garbha utpatti. According to Ashtanga Hridaya, Sharistan 2/6, they explain the Utpatti, Jivana, Riddhi, and stability are credited by the Rasadhatu. Right now, what is the Garbha Utpadakar Bhav? That is factors affect, harmful for the fetus. They have mentioned in Charak Sharistan 14/18 and the Charak Shari 8/21. Acharya Charak has mentioned the Garbha Utpadakar Bhav, harmful factors. These are they all those are very heavy, heat producing, pungent food. All the violent movements, sitting awkward, uneven, hard seat, or inclined to suppress the urges like flutters, urine, feces, or the usual to indulge us into violence and exaggerated. The fetus by this fetus get died up in the womb and or it's delivered prematurely. So because become and it get atrophied. And Ashtang Hruday also having same similar loose on Garbha Utpatikar Bhava. Right now, the Hridayani fulfillment. Hridayani refers to the mother who carries the second heart of the growing fetus. Sushruta has mentioned the Chetna Dhatu Abhivyakti and Garbha Hridaya Pravyakta from in the 4th month, due to which fetus start growing and moving and expressing his desire through the mother. According to Acharya Sushruta, if the desire of the Garbhini is not fulfilled, then Garbhini will give the birth to the child who is a Kubja, Kuni, Khanja, Zada, Vamana, Vikrita, Aksha, Andhata, and called a Garbha Vyapad. If the desire are not fulfilled, behavior and psychology changes due to psychology changes. That is a Krodha, Shoka, Bhaya, Trasa, Indriya, and Pratikulata occurs in the body, mother's body, resulting in the nutritional deficiency in the developing fetus and the hormonal imbalance in the pregnant woman, result in the Garbhastava, that is a miscarriage, and Garbhapata, that is a abortion. From all this, we can see the hetu for the Rasava Strotas Dushti and hetu for the factors affecting the Garbha. It is harmful factors affecting the Garbha are exactly the similar. And the conclusion, unwarm ahara and altered lifestyle lead to dietary alteration or the lifestyle variation are a prime cause for the manifestation of Rasava Strotas Dushti. The niran of the both Rasava Strotas Dushti and Garbha Utpatakara, Upaghatakara Bhava are the similar. From all the literature review, we can see Rasava Strotas Dushti caused by the hetu, such as the eating heavy, cold, very untouched substance in moderate quantity, worrying too much. It causes rasa dhatu dushti, which affect on the conception, that is garbha utpatti, and may cause a garbha strav, that is a miscarriage, garbha pata, that is abortion, as a garbha portion, that is a fetal nutrition. Rasa dhatu vitiated by a garbha upaghatakar bhava. Rasa dhatu is the first insect of the food. Any dushti of the rasa dhatu will ultimately affect the production of the upadhatu, that is stanya and raja, which further result in a stanya shaya and a raja dushti, that is a menstrual disorder respectively. Pregnancy is the most challenging phase of the life. Of the woman's life. It brings about the physical and psychological changes in her body. Maintenance of the physical and mental equilibrium during the pregnancy is a much important factor. If not, they will result in many complications to mother as well as the fetus. Garbha Vikruti can be contributed to long-term disability, which have the significant impact on the individual, families, healthcare system, and the society. With the help of the Ayurveda, prevent such situation by using a Garbhini Paricharya, Masanmasi Garbhini Paricharya, which not only give the strength to the woman but also relieve the mental stress of the woman. Thank you, ma'am. Thank you for listening my presentation, paper presentation. Thank you.
Thank you, doctor. Today's presentation is approximately over. Thank you, dear participants.